Semitic, Holocaust-denying, convicted criminal. And that is my hope, that when we have this vote later in the week, we might decide that the United States can do better by our ally. With that, Mr. President, I yield the floor.
Senator from Virginia.
The absence of quorum.
The clerk will call the roll.
Lose their health care sometime in the next few months or so. And so the Democrats are saying, if there's going to be a spending bill, you can easily avoid a shutdown by addressing this health care crisis, and that means canceling the cuts, lowering costs, and saving people's health care. So I think I'm now going to introduce Dr. Anand Singh, who is well, he's an internal medicine resident. So you're a resident physician in Baltimore, has a real passion for healthcare policy and caring for people who are his patients. He has a lot of leadership roles. I'm not going to go through all that, but he's a real advocate for health equity. And so, Dr. Singh, thank you for joining us today, and I'll turn it back to you to introduce.
All right. Well, thank you, Frank Pallone. And now I'd like to introduce our other expert who has joined us. Dr. Anita Michelneni is a passionate advocate for women's health, patients' rights, and reproductive justice. She is an OBGYN at GW right here in D.C., and she is a longtime champion for women facing systemic barriers to care. So thank you both for being here, and we're going to start with you, Doctor. I wondered if you could share with us through your lens as a provider and an OBGYN. We are seeing reproductive health care just under siege, most recently by this Republican budget. And what are the effects that you are seeing both in your practice here in D.C. and across the country?
That's a great question. And, I don't think it surprises anyone that women in this country are just feeling completely left out of the conversation in terms of research, coverage. Every day I'm seeing patients and I'm like, well, we just don't know about that, or your insurance isn't going to cover that. And there's kind of a shrug of like, yeah, of course, because I'm a woman in this country. And what we are seeing boots on the ground is really dangerous. And when we talk about the Affordable Care Act and not being able to afford regular preventative care, the irony here I find is this word budget. When I think about budget, when I'm budgeting my household, I'm trying to save money, right? It doesn't take a rocket scientist to figure out that a very complex cervical cancer surgery with chemo and radiation is a lot more expensive than a patient coming in for their pap smear. It doesn't take, a genius to figure out that somebody who's unvaccinated with COVID and is in the ICU day after day after day. I've done a C-section in the ICU for someone with COVID. That is a lot more expensive than people who want to come in for their prenatal care and maybe catch things much earlier, or allow me to counsel them on the safety of vaccines and pregnancy. It's not about budget. It's about marginalizing women, and women are sick of it. And that's without even getting into the whole abortion conversation, reproductive health care, which, if you're really serious about, decreasing the number of abortions in this country and making pregnancy safer, why are we attacking contraception? That just makes no sense to me. So we're just seeing women getting attacked on all fronts, and it's not only leading to women giving up in this country about their own health, but physician burnout. We're getting maternity deserts, not just in rural areas that can't afford to take Medicaid in major cities. I could go on, but I will push my time.
Well, there's a lot to say. And what are you seeing? You mentioned Dr. Burnout, and this is something that we are hearing a lot. And now that in 1/3 of all the counties in this country, there are no OBGYNs, and in some states that's much higher. What do you have fears for the future of your profession and having a robust OBGYN workforce in the future?
I have fears right now. We are seeing lower rates of residency applications in states that won't provide adequate abortion training. We are seeing family planning fellowships not necessarily filling all their seats because, surprise, surprise, people don't want to go to jail for providing standard health care. It's not a shock. And, when we talk about physician burnout, as OBGYNs, we're a bit of adrenaline junkies. If somebody comes in the middle at 2 a.m. in the middle of the night, bleeding to death from an 18-week pregnancy that is not going to make it by every medical standard that's out there, if it has a heartbeat, the burnout is not from how do I medically manage this very complex situation. The burnout is, do I have to call a lawyer right now to ask if I'm allowed to do what I know is right? And that is where you're seeing people leaving states like Idaho, South Carolina, and places with a lot of abortion restrictions because, we have families, we have our own livelihood, we have our community. We don't want to have mental health conditions due to this burnout. We don't want to go to prison because of the calling that we signed up for. So, and the Hippocratic oath that we took. And in no other field of medicine do you see that kind of pressure.
Yeah. Well, do you wanna...
Yeah, let me ask a question of Dr. Singh, if you will. As was mentioned, when we talk about a healthcare crisis, it takes many aspects, right? I mean, it's an access crisis, right? Right now, people are concerned because because of the recommendations from the Trump administration, they can't get vaccines, right? There's a research crisis. But I think it's primarily an affordability crisis. So what I wanted to ask you is, how do you think these Medicaid cuts and the big ugly bill, the fact that the Republicans are not willing now to extend the tax credits for the Affordable Care Act, what is that going to mean for this affordability crisis? Isn't it just going to make it worse?
Yes, and first, thank you so much for organizing this and being leaders on this issue, because as healthcare costs continue to rise, we are in a crisis with patients not only being able to access healthcare, but also being able to afford healthcare as well too. And you hit it right on the spot about affordability is a huge crisis that we are about to enter if this premium tax credits are not extended. And speaking as myself as a trainee, I spent hundreds and thousands of hours, learning in medical school how to treat conditions, how to provide the best patient care possible. However, nothing could have prepared me for when I started as a primary care physician at a federally qualified health center, taking care of many underinsured and uninsured patients who are coming in and trying to get the best care possible. However, they're not able to receive that care. And one patient that comes to mind is, this person works in the hospitality industry, and they were unfortunately found to have a benign tumor on their leg, and it required surgical removal. However, they're not able to afford it because they're uninsured. They're afraid of how much it's going to cost to buy insurance on the marketplace now if the premium tax credits expire. And on top of that now, how are they going to work with their livelihood if they're not able to get that surgery? And so it's just a compounding effect that is continuing to worsen when our patients are not able to get the health care they need due to costs.
I appreciate it. And Catherine, I just want to say, look, we're here. I'm going to repeat it. We're not on vacation like the Republicans because we realize this crisis is here, and Republicans aren't even willing to address it and just want to shut the government down. So thank you all for being here today.
I wanted to ask really to both of you if you could sort of walk through what is the patient experience when you don't have insurance? Is it the fact, like you referenced, that preventative care gets put off until it can be an emergency? Is it just unable to get the referral or the surgery that may not be an emergency surgery, but is something somebody needs to live with? Like, what are sort of the pain points as patients work through the system when they can't get insurance?
Let me just start this off by saying insurance is already very complex, right? And it is already very hard to make appointments when you have children, when you have a full-time job. Our office hours are the same as your work hours, so often you have to miss your own work to come to your appointment. So it's already so hard. Add another layer of, I just can't even afford it. People are just going to assume, there's nothing else they can do. They're just going to hope for the best, that maybe I won't get sick, maybe I won't get injured, maybe I won't get pregnant. and hope for the best, and then they're going to end up in the ER and put a huge strain on our ER systems. They're going to end up in much more medically complex situations. Again, going back to the fact that it doesn't actually save you any money if you avoid going to preventative health care. And I think, like a lot of things we're seeing in this country, people are just going to lose faith in their healthcare system, because often it's not them looking at, their representatives or whoever voted for the situation they're in. They're looking at their healthcare providers and looking at us and saying, how did you fail us? Yeah. And it's disingenuous, it's untrue, and it's absolutely not what us as healthcare providers want as well. So, yeah.
It's absolutely right. Things weren't working great before we got to these major cuts. So you shared one story. What else are you seeing with your patients?
I mean, I think just to add, I know we discussed earlier about physician burnout as well too. I think especially as a new physician moving to a different state to practice medicine, I think it's already, imagine how difficult it is for patients, physicians as well. We're learning how to navigate a system that's constantly changing, as medicine is one of the most regulated industries in the country. And so when we're looking at this, especially as a physician, when I have, for example, this patient who is not able to afford the surgery they need, I feel as if the burden, and it is rightfully on me to making sure that I can take care of the best possible care for my patients, because I'm their primary care doctor, and I'm kind of, as we see it, like the quarterback of making sure that they get all the care they need from all aspects, whether that is to OBGYN or whether that is to surgery. And so as the primary care physician, it's a lot of burnout on me to making sure that, okay, what are some financial assistance programs out there? So now I'm taking it upon myself. So, I'm already spending 80 hours in the hospital weekly, but then on top of that, I go home and I'm researching what are some financial assistance programs out there? How can I better support my patients? And this is just adding more time into my already busy schedule when, I want to spend time with my family. I want to spend time with my friends, but, I also really value, and that's why I went into medicine, is for patient care. And so it's really putting a burden on physicians. And I know we were talking about it earlier as well, but I'm fearful for the future of healthcare overall, and if we go down this path, because it is going to lead to burnout.
Well, Catherine, the other thing, we've been stressing Medicaid cuts, Affordable Care Act, but when you talk about an emergency room or a community health center, bottom line is, if people don't get that care because they don't have insurance, right, then the cost for everybody else's insurance, even in the private sector, goes up, right? So before these cuts, we were already hearing about, double-digit increases for the private sector, for people who have jobs or not, have insurance through their job. And that's only going to get worse too, right? Because if they have to go to the emergency room, they don't have insurance, it goes into uncompensated care, and then everybody else's insurance goes up as well. I mean, if you want to comment on that.
Yeah, I think it goes back to, I remember taking economics in high school, but there's no such thing as a free lunch. And so that's like economics 101. And unfortunately, when you look at the healthcare system currently, is that as from a primary care perspective, we're trying to avoid these emergency department visits, because studies have shown that these emergency department visits are much more expensive compared to just going to see your primary care doctor who knows you better, who has a longitudinal relationship with you, and who can actually get you to the right specialist. When you're walking into the hospital, I think the moment you step in through those doors, I think from my end, I feel like we've already failed, because we wanted to prevent that from happening in the first place. And I think that's where it's getting difficult, is trying to navigate how can we make sure that these patients aren't, going to the emergency department. How can we make sure that they live their healthiest lives possible? And when you add these factors such as cost, such as like accessibility, such as just overall management of like care, it gets really difficult to navigate all of that.
And what really bothers me, Catherine, too, is that these Medicaid cuts and this refusal to extend the tax credits for the Affordable Care Act or Obamacare, they were all done in order to give bigger tax breaks to large corporate interests and to the very wealthy, billionaires, multimillionaires, whatever. And so when the Republicans say to me, well, I don't want to extend the tax credits for the Affordable Care Act, I said, well, you made the tax credits permanent for the billionaires and the corporations, so why don't you want to make the tax credits permanent for the people that need them to get their health care? I mean, the Republicans have created this crisis. This is of their making.
It is of their making, and they have not shown up today to help us put the voices of American people back into this discussion. But you did, and we are so grateful to both of you for being here, for the work you do, for being advocates for patients and for doctors. And we are in this fight with you, and we really appreciate you bringing your experience and unique expertise to this discussion. And as always, Frank, we're so grateful to you and all the work you do on energy and commerce to make healthcare a reality and affordable and accessible for everyone. Thank you all so much.
Nice to meet you. Somebody give me a high sign. Don't be nervous. Don't be nervous. No, don't be nervous. We're just gonna have a good conversation. Okay. Who's gonna tell us to start? We're good? All right, we're good. Thank you. Welcome back, everybody. We have a new panel and a new opportunity to talk about the importance of healthcare in our communities. I'm Pete Aguilar. I'm the chairman of the House Democratic Caucus. I'm here joined by my friend and colleague, the ranking member of the Ways and Means Committee, Richie Neal, as well as we're joined by Sparkle Edwards and Julia Tilley, two dedicated home care workers who are going to share their healthcare stories and experiences. As you know, right now, we're experiencing a healthcare crisis thanks to Donald Trump and the Republicans' big, ugly law. This legislation represents the largest cut of healthcare in American history, and we're seeing that fall out nationwide. Hospitals are closing, patients, wait times and travel times are getting longer, healthcare workers are losing their jobs, and everything is getting more expensive. This urgent issue demands action. And that's why we're here today, to highlight the real-world consequences of the Republican health care cuts. We want to hear your stories, but I did want to ask Richie Neal to talk with us about the importance of why we're here.
Well, thanks, Pete, and thanks to all of you, and thanks to our guest panelists here. This is really important because we really want to hear real-life stories. And I think anybody who has ever visited a long-term care facility, you're familiar with the great work that SEIU does, coupled with the fact that oftentimes in a family, loved ones stay together as long as they can. And then when they can't anymore, because they can't so dramatically change their own lives, long-term care becomes essential. So the tax cuts that took place, people don't quite comprehend yet what this means for long-term care. And what it means is that 52 cents on the Medicaid dollar now goes to long-term care. When Lyndon Johnson signed the legislation in 1965, it was for poor children. No longer. It's become a middle-class benefit. But you know what it's like for those families on the front line when you visit, when you care for them, and you know what it's like when they have to be changed, when they have to be cared for, when they have to be fed, when they have to be put to sleep during the evening, when they have to make sure that there's security on the facility. So I think hearing from people like you is essential, largely because if you point out that the tax cuts really are being used to justify the cuts in spending on Medicaid and Medicare. And you experience this every single day.
Julian, thanks, Richie. Julia, can you tell us a little bit about how rising healthcare costs will weigh on you and your family?
Sure. I'm a home care worker, and I take care of my daughter who has some physical disabilities as well as autism. And I left my career to take care of her. And like many of other home care workers that have also left their jobs to care for their families, it was a hard decision financially to make, but it's a decision that I'm very proud to have made. For my home care work, I only make $14 an hour. I don't have any benefits through my work, no paid time off, no vacations, no health care. So initially, for a long time, my husband and I had Medicaid, but then in the last 2 years, we were able to get insurance through the Affordable Care Act, which has been a real blessing. But now we are faced with this double whammy. With the cuts to Medicaid looming, that's how all the care for my daughter is funded. In fact, many of the programs and things that she qualifies for, they don't even take private insurance. They only take Medicaid. So we're looking at that, and it's really very terrifying. We're also looking at now the cuts to the premiums for the Affordable Care Act, which, you know, if you look at it, the numbers are all over the map. We don't know. We don't know what we're going to be asked to pay. I mean, it's just sort of like you wake up one day and surprise, surprise, you could have a $10,000, a $20,000 bill sitting on your desk. I mean, some of the projections say that it's going to be an 82% increase. I don't know any family that can financially sustain that. I mean, for an example, if you had a couple that were working, each of them make $50,000, so they make together maybe $100,000. They're on the Affordable Care Act. They get this huge raise in their premiums. The average might be around $24,000 total that they're going to be asked to pay on top of all the bills that they're already paying. And I just think that's horribly, horribly, not only unfair, but it's un-American to let people have to scrape by and suffer and not have the care that they need while billionaires get another, they get another tax break. They can, somebody said earlier, Elon can go buy another rocket. That's not fair, and it's not American.
Can I ask a quick question? So that means that your annual salary is less than $30,000?
Yes.
Yeah, I just did the calculation here. $30,000 to care for a child as well.
Yes. And it's not like I can not do that and go get a job that would give me benefits because my child still needs care. Yeah. And if I did, there would just be another care worker doing the same job without benefits.
And you're facing it on both sides.
And I'm
The
facing,
care-
yes,
the
absolutely.
care that your child needs is derived from Medicaid,
Yeah.
and then the health care that you receive, that you rely on.
Correct.
Those costs will go up potentially thousands of dollars a month.
Right. And if mom's not healthy,
Yeah.
the family's not healthy.
What decisions would that mean for you and your family if those costs went up, as you said, 80% or $1,000, $2,000 a month?
I don't even really know how that would play out. We're counting on you guys. And we're very, very grateful for the line that you're holding and that you continue to hold, and we're with you in the fight.
Thank you so much. I appreciate it. Thanks for sharing, Julia. And Sparkle, tell me what Medicaid means to you and your family, and how it helps people live a life with dignity.
Thank you for the question. First, thank you for the opportunity for allowing me to be here to speak today. When it comes to Medicaid and how it helps families, I have worked in the Medicaid space for 20 years, outside of being a home care worker for my uncle. My uncle had a stroke in 2020 during the height of the pandemic, and he's very young, so he was not a senior citizen. He was not even 50 years old when he had this stroke, and it changed his life. It changed the lives of our family. Before applying for his Medicaid, we were paying out of pocket for medical equipment. Do you know the cost to rent a hospital bed? The cost to pay for some of these medications out of pocket. At the time, I was working in the Medicaid space as a care coordinator. So we applied for his Medicaid. He was able to receive a waiver and get the care that he needs. Having health care should not be a luxury, right? It's something that everyone needs. It's a right. It's not a privilege to have health care. It should be a right. You have a sense of dignity when you're able to go to the doctor, when you're able to care for yourself. Having access to health care, it helps with your self-esteem, it helps with your self-worth, because all of these things are impacted by not having access to health care. I don't know what it would look like for my uncle not to have care, not just my uncle, but other Americans to not have care, because it's extremely important.
Sure. So, Sparkle, When we wrote the Affordable Care Act in the Ways and Means Committee on the tax credit side, you used the word access many times in your brief presentation. That's what the argument was about. Access, getting people into the system at an earlier stage of life because the emergency room was a bad place to get health care. So on a panel I did earlier today, I raised the issue because one of the heads of the Diabetes Association talked about what these cuts would mean. And when I had a chance to question him, I said, isn't it true that obesity, as it relates to diabetes, then causes heart disease as you go forward, and hypertension as you go forward? So the whole idea was if we were treating this at an earlier stage of life, rather than in an emergency room, that not only could you manage it, but you might effectuate a substantial change in how that individual lives. And that was the whole idea of the Affordable Care Act, coupled with the fact that there's no denying this reality. 20 million more Americans today have health insurance than they did before the Affordable Care Act. 20 million people.
It's truly amazing. And Sparkle, one of the things we wanted to ask you, the number of times that Richie has heard Republicans talk about the term waste, fraud, and abuse. They say that we're wasting money on these programs through waste, fraud, and abuse. What does that mean to you when you hear them say that? What does that mean to you?
I'm so glad you asked me that question. Before stepping into the home care space, I was a Medicaid fraud investigator for the state of Virginia with one of the managed care organizations. So when I hear you ask that question, it's a loaded statement that is made by the other side, right? Fraud, waste, and abuse, I think with the proper education of not just providers, but also of recipients, we can mitigate that problem, right? As it relates to fraud, I think it's an overinflated number that they present. Majority of Medicaid providers and recipients, based on my knowledge as a previous fraud investigator, the numbers that they're presenting is very inflated. Most Americans that are receiving these benefits, they're not committing fraud. They're not wasteful of the services. They're appreciative. What you really should know, from my experience working in this space, is that a lot of people, even though they have the coverage, even though they have Medicaid, they're still not going to the doctor as much as they should, just because they're unsure of what may be found out when they go seek care, right? Because of the fear of not having access to health care from previous times. So fraud, waste, and abuse, I think, is something that is used to try to scare the American people and scare Republicans into changing their mind about giving access to health care for Americans. But fraud is not a problem.
So you know what is fraud? It's when the President of the United States, during the State of the Union address, said that there were 300-year-olds getting Social Security benefits. That's fraud. And, well, maybe not 300-year-olds, only 200-year-olds. So the accuracy rate for Social Security payments is 99.9%. So when you hear that term, waste, fraud, and abuse, I was so offended. And then it was called a Ponzi scheme. Yes. Come on. Yeah. Thanks, Pete.
Thank you. Julia and Sparkle, I'm so sorry. Thank you so much for spending time with us and sharing your stories and for everything that you do. It really means a lot that you would come out and you'd share these stories. Thank you.
Thank you for your time. Thank you.
That was good, Pete. Thank you.
Are we ready? Good afternoon, everybody. We're glad to see everybody here and watching this. Donald Trump and the Republicans in Congress have made the largest cuts in health care in the history of this country. dangerously ripping coverage away from millions of people. And I care about everybody, but when it's children, I get particularly upset. In fact, more than 50% of the kids count on Medicaid or CHIP. More than 50% of the children in this country count on Medicaid or CHIP for their health care. So sitting with us is Chelsea Anders, the founder and executive director of Little Lobbyists. I love Little Lobbyists. I think you're the most effective lobbyists in the country. And thank you for being here.
And I'm Nanette Berrigan, the co-chair of Steering and Policy. I represent California's 44th district. It's really a great honor to be here with you today. And I get to introduce Rico Winston. Rico is the founder and the executive director of Israel Winston Family Empowerment Corporation, an organization that supports families of children with special needs. Rico, you have turned a personal journey into a mission of advocacy for those living with developmental disabilities like your son Israel. Your work is crucial, and it's so critical because it's rooted in lived experience and a deep commitment to inclusion and access for families like yours. Thank you for being here, and thank you for bringing. Is this Israel?
Yes, this is.
Fantastic.
It's great.
Thank you.
Israel, it's great to have you here. Chelsea, I've been honored to work with you over the years, and you and your family have such an incredible story, so I want to get right into it. Can you tell us a little about yourself and your family and why you all made the decisions from move to Texas to Pennsylvania?
Yes, absolutely. So I am the very proud mother of Olivia Anders. She is 10. She just entered the 5th grade, and she is the reason that we do all of this. We lived in the state of Texas, and despite the fact that it has a very low cost of living, we could not afford to stay. We made the very difficult decision in 2023 to move to the state of Pennsylvania specifically for her health care. We experience the same types of struggles. We have the same types of costs as Rico's family, as any other family that has a child with medical complex needs does. Olivia's daily care that helps her live and thrive is something that is out of reach to my family without Medicaid waiver programs. Her formula, her medications, $2,000 just for the formula that she uses to get her nutrition, right? A manual wheelchair, $8,000. A pre-owned van in order to put that wheelchair in, $70,000. Wow. And my husband and I are fortunate enough to probably be in the top 5% of earners in this country. We have very good tech white-collar jobs, and yet we are one medical emergency away from destitution. So when we moved to Pennsylvania, we're able to take advantage of the Medicaid waiver programs to cover those costs for her. And when we cut for that coverage, a Medicaid waiver is optional, right? That is not the and talk about all the time. This waiver program is partially funded by the federal government. That would also go away. So how do I continue to work this very high-paying job and still take care of my daughter if all of that goes away?
And is that help part of the Medicaid program?
Mm-hmm. Yes.
Wow. Well, thanks you for sharing. And Rico, I want to turn to you. Can you talk about Israel's experiences as a young boy with a diagnosis on the autism spectrum and how he has inspired your advocacy and your community engagement?
Yes, good afternoon, everyone. First of all, I wouldn't be sitting here if it wasn't for the challenges that I face as a parent trying to navigate what I call, quote unquote, the battlefield of autism. But instead of me telling a story, I'm glad I had the opportunity now for my son to tell our story and our journey together. You ready, son, Israel?
Yes.
Okay.
I just want to say first, before I start, good afternoon, everyone. How's everybody doing?
Good, thank you.
Good. Thank you. Let me get started. My name is Israel Winston, but you can call me Izzy. I am 16 years old, and I have autism. Medicaid is important to me because it helps me live my best life. Early in my journey, I wasn't able to speak. My father and I were learning sign language, but thanks to Medicaid, I am able to share my story. Medicaid helps me to be strong. It helps me to advocate for myself and others. Without Medicaid, I would not be here before you today, sharing this important message about Medicaid. When people can see a doctor get the medical services and support they need, they live their best lives. I've received speech therapy, occupational therapy, as well as the necessary medical supports to give me the best opportunity for my growth and development. Medicaid is essential for my continuing growth and development because I am the future of this great nation. The reality is it's not just about me, it's about every American, but also the future of this great nation, the United States of America. Thank you.
Wow, Izzy, thanks for sharing that story. And I could see why you're inspired and why you advocate so hard for Izzy and, children like him. And that's what we House Democrats are doing. We're here to fight for all Americans because we know healthcare impacts everybody.
Chelsea, let me ask you a question. One, I think for both of you, what would it mean if you lost the Medicaid support? But what do you want America to know about Chelsea and other people with children with complicated problems, and why they matter so much and why they're so effective as little lobbyists?
So we have a family mantra that we are pushing on our little lobbyist friends and families as well. We live by the mantra, there is no such thing as other people's children, right? We are asking our elected representatives to not only understand that, but to meet us where we are, right? We are not asking for handouts. We are not asking for any type of special treatment. We are asking for help in equaling out the playing field in a way that we can make sure that our kids get to the next phase of life, right? Like I'm sitting across the table from Izzy with tears in my eyes because I would love it if Olivia gets to the point where she can advocate for herself like Izzy does, right? She can't do that without the medical interventions and the developmental disability supports that she needs. She can't do that without someone to teach her how to use her speech device. It's not going to be me, right? I'm just a IT program manager. I don't know how to use an AAC device. I am learning with her, right? But if I don't have the opportunity to buy that $17,000 machine for her to use, how do I give her the power that Izzy has to use her own voice and to prove that she is worthy of this healthcare, right? We just want our kids to be able to grow up and have a future. That's all. That's all. And we would pay for every single one of these things ourselves if we could, but we can't. We can't.
Well, thank you for sharing that. Rico, navigating a developmental disability like autism comes with unique challenges, and you mentioned a little bit about that. As a parent, can you share what it's like to worry about your child being able to access the healthcare services they need to thrive?
It's overwhelming. It's fear. So the absence of resources such as Medicaid to provide the stimulating programs, OT therapy, speech, and so forth, there's no telling where he would be. He wouldn't be sitting here, and I wouldn't be here, because it's emotional to see your child not being able to speak or to say the words, I love you. It's devastating. So this has propelled me to advocate initially for himself, but for me to find the strength for us to join together and to advocate for other children and their families. I don't want us to even think about what his future would hold if he still cannot have the resources that he needs, such as Medicaid, in place to put him continuous on the trajectory as which he is on now.
I just think, look, I'm somebody who thinks everybody should be able to go to the doctor when you need it and get the resources that you need. And I've watched you probably don't remember this, I've watched you grow up. And you have become the most articulate young man, and you're helping so many people because you were able to have people that helped your dad and you. And I want to thank you for being an advocate for all the little kids that need us to be a voice for them. And I just think every child should have a future where they can get the medicine that they need, the treatment that they need.
Yeah, and it's really great to be able to see Izzy with us today, to be able to advocate for himself, because there is nothing more powerful than the story, your story, and you sharing your story. So thank you, Izzy, for being here, and we look forward to the day that Olivia will be able to also advocate for herself. And
she's got a lot to say.
And
she's very powerful. Have you met Olivia?
I've not met Olivia, but
we are so blessed to have parents and children that care enough to help be a voice for those that can't get here or are afraid to do it. And that's why we're here, because we need to make sure those that need a helping hand are getting that helping hand and help up.
Yeah, and so just know we're here for you. We're here for your family. Democrats are all about canceling these cuts to Medicaid. We're all about lowering cost and premiums and fighting for the extension of the ACA subsidies and saving your health care. And so that's why we're here today. We're going to stay in Washington to do that. Thank you all for sharing today.
Thank you.
Thank you for having us.
Well, good afternoon, everyone, and thank you so much for being here. I'm Congresswoman Lori Trahan, and I represent Massachusetts' 3rd Congressional District, home to so many hardworking families who are staring down a Republican-made health care crisis. Here's the reality. With just hours until before the government shuts down, Republicans are nowhere to be found. They have walked away instead of working with Democrats to protect your health care, to keep hospitals open, and to keep basic services running. And this didn't happen by accident. Earlier this year, Republicans and Donald Trump slashed $1 trillion from Medicaid, the biggest cut to American health care in our country's history, all to pay for tax breaks for billionaires. And now they're refusing to extend the Affordable Care Act's premium tax credits, the very thing that makes coverage affordable for millions of Americans. If they succeed, costs will skyrocket, families will pay thousands more, seniors could see their premiums jump by over $14,000, and hundreds of thousands of people in my home state of Massachusetts could lose their coverage. At a time when working families are already being crushed by the rising costs of groceries, housing, utilities, Republicans are making health care less affordable too. And that's unacceptable. Democrats are here in Washington. We're fighting to stop this Republican health care price hike and to protect the care that every family deserves. And I'm proud to be in that fight alongside my good friend and health care champion, Congresswoman Doris Matsui.
Thank you very much. She's really a champion yourself. Thank you, Representative Trahan. And I want to thank you all storytellers here for being with us here today. We're looking forward to listening to you. We're here to talk about the Republicans' health care crisis and their attempts to cut credits that keep affordable coverage in reach for over 20 million Americans. If we don't extend the tax credits now, those families are going to see huge increases in their premiums. In the coming days and weeks, millions of Americans will get notices that their premiums are more than doubling next year. An estimated 5 million Americans will drop coverage entirely because of that. That's why Democrats are standing strong. Democrats know we have to cancel the cuts, lower the costs, and save health care. We can't let Republicans reverse years of progress we've made since the ACA was written and passed. And it's not just an attack on families. Republicans' refusal to extend these credits is an attack on small businesses. Half of Americans who rely on premiums tax credits are small businesses, small business owners, employees, and self-employed entrepreneurs. I've heard from small business owners in my district who made it clear what will happen if these credits expire and premiums skyrocket. They'll be forced to either cut back on, growing their businesses or make the difficult choice and not cover their employees' health care. And in the face of this uncertainty and inflation caused by the Trump administration, they can't afford another blow. I'm excited to have two amazing speakers here with us today to help illustrate the impossible situation Republicans have created for small businesses. Marcia St. Hilaire Finn and Kara Pitt DeAndrea. Marcia and Kara, could you tell us a little bit about your work and what the premium tax credits mean for you and the people you work with? Marcia?
Yes. Hi. Thank you for the opportunity to share my story today. I am Marcia St. Hilaire Finn, and I'm the founder and CEO of Bright Start Early Care and Preschool in Washington, D.C. I'm also a Small Business of America Future Network member. I started Bright Start in 2002 in my basement with 5 children, including mine. I worked weekends as a certified pediatric nurse. My experience in the healthcare taught me that when families can't afford healthcare or childcare, their children pay the price. Today, I operate free centers employing 51 early childhood educators. Small businesses like mine are facing unprecedented challenges. We're dealing with higher operational costs due to inflation, skyrocketing healthcare expenses, and constant economic uncertainty. For example, cuts to the federal workforce this year have already cost my business several families who lost their jobs. We've never recovered that revenue. Now, we're facing another threat, a potential government shutdown, which would mean more federal workers being furloughed without pay or losing their jobs. Since many of our customers are federal employees, this means more families will leave my business. Every furlough, every firing ripples through small business like mine. Congress is fighting over the fate of tax credits that help millions of Americans, including many small business owners and their employees, afford health care coverage. Without action, these credits will expire at the end of the year, and health insurance will soar by an average of 20%. The fact that the majority of members of Congress appear ready to hold our entire government hostage, threatening the paychecks of federal workers and the stability of small businesses just to strip affordable health care is mind-boggling. Without action, these credits will expire and healthcare becomes unaffordable for millions. A recent Small Business for America's Future survey found 55% of small businesses have owners, employees, or families who rely on these premium tax credits. When childcare workers can't afford health care, they leave the industry. When childcare becomes unaffordable or unavailable, parents leave the workforce. I'm fortunate because a DC healthcare program subsidized by federal tax credit allows us and my workers to get free coverage. But if these federal credits are cut, rates will spike and I'll lose the workforce I've spent years building. Congress must learn from that example and help those who form the backbone of our economy. Small businesses employ nearly half of America's private workforce. So support small business by extending enhanced premium tax credits.
Andrea. I run a nonprofit daycare in Milwaukee, Wisconsin. I'm also a member of Main Street Alliance, who supports small businesses across America with over 30,000 members and small businesses to give a voice to us when we don't have other lobbyists or other people helping to speak up for us. Marcia said a large amount, which I would like to piggyback on, which is a very important points that I think what's extremely important is that personally, I also receive my health care from the marketplace, like many people in this room. And as an advocate for early human development, as an advocate of healthy families, as an advocate for our community, I've made the conscious choice to stay in the nonprofit sector, in a sector that is highly devalued, highly fragile. And I've done that because I've been able to bridge my health care. I've done that because I believe in the commitment, and I've been able to do that because I've been able to bridge my health care with the marketplace and with the Affordable Care Act. And there's been so much rhetoric around Republicans versus Democrats on who's showing up and who's not. And I think what's important, other than the names of the parties, is there is a group of people who are here in Washington, D.C., who are sitting at this table, who care about the community, who care about the American people, who care about small businesses, who are here showing up to advocate, to fight for affordable health care, which is a ridiculous conversation that we even have to have in the United States of America. But here we are, again, having this conversation. And then there's a group of people who do not care. And that's it. And action speaks louder than words, and that's what it comes down to. And we hear the rhetoric of holding hostage DC. We hear that the Dems are going to force the shutdown. We are asking Republicans to come with reasonable talking points to extend the Affordable Health Care Act. Beyond, just don't hurt us. We want to show up for you. We want to take care of your children. We want to be the small businesses that bridge the gaps that big corporations cannot give. Marcia cannot give. Marcia and I are in unique positions that we run centers that we get to help make the rules for families that need different hours, for families that need exceptions, for families that need scholarships when there are furloughs, when there are layoffs, when they're trying to go to interviews but they haven't been given the funding for their childcare. Healthy childcare, quality childcare makes healthy families. Healthy families make great employees for the rest of the country. Great employees make America a lot of money, right? Good business, if the United States of America is run as a business, great businesses give their employees the best benefits possible. And the best benefits possible right now is to pass a sustained, long-term, locked-in, affordable health care to let us keep providing the services that we just want to be great at. We just want to take care of your kids. We just want to provide services that other businesses don't provide. So let us do it and support us.
Well said by both of you. Thank you, Marcia. Thank you, Kara. I'm going to start with you, Kara, because 82% of small business owners are on the marketplace, and they rely on these enhanced tax credits. And some people will ask us, well, why are you having this fight now, right? Why, they don't expire till the end of the year. But can you share why stability and certainty in these credits at this moment are so important, both for running an existing small business and for entrepreneurs who are just starting out?
November 1st, millions of us will be asked to make the choice to select our plans. Millions of us. And we want to select the plans that we can afford. And we want to select the plans that best serve us. And we don't know what that is. And so, if we know the storm is coming in December, we don't need to wait till December. We can head off the storm right now. You all can head off the storm. Republicans can head it off. I said earlier today, not one member of Congress would tell their daughter or their son to sign a rent on an apartment or a lease on a house without knowing the rates, right? It's bad business. It's negligent. And the families that we serve, many of them run small businesses. And if they sign up for plans and then cannot afford childcare because of their plans and have to piece together childcare, then in December, our businesses look very different. And then we cannot employ the people, and then they cannot spend their money in the communities. And so, and so if people cannot rely on the rates, then it's an untenable, uncertain future. And so what we're asking for is, just give us the certainty that you will be there to support us so that we can continue to support you.
Let me just see. Marcia, I want to ask you a question. Sure. Excuse me. Marcia, I want to ask you a question. I am a strong believer that prevention saves lives. The ACA put affordable preventive care in reach for millions of Americans. Now, Marcia, can you tell us how important it is that your employees have access to preventive care that helps keep them healthy and well, especially as a child care worker?
Well, thank you. Yes, so in the early childhood space, it's important to have healthy educators or healthy providers. If they're not healthy, they can't take care of children. If you have children, you understand the energy that is needed to take care of a child, right? So for an educator to show up and ready and willing to take care of your child, and today we are faced with a lot of challenged children, a lot of behavioral issues, which requires more patience, more energy, more health, well-being. So in our space, if we don't have the ACH, even though in DC it's subsidized, if that goes away, then the cost is now passed on to our early childhood educators who can't barely afford it. Prior to the ACH, we subsidize it. With the increased cost, I don't think we'll be able to. That would mean loss of workers, and in childcare, it's a numbers game, right? And it's not plug and play. Teachers need to be trained on how to handle the children with emotionally behavior. So in that case, we would have to look at our employees, maybe reduce staffing hours and no benefits. And for someone, I pride myself on providing, when I started, that was one of my big things, make sure that teachers in that space are respected and feel valued. And the way they feel valued is through benefits. So for me, that would be very devastating because now I'm going against what was the impetus for me to do the early childhood, to provide value in benefits to the providers. So the ACA going away would really devastate me and our company, and even the teachers that love what they do. We want them to show up every day and feel valued. So we want it to be around.
Thank you so much, Congresswoman Matsui, Marcia, and Kara. We all know about the ripple effects when you take health care away from families, from children, from seniors, but I think you were really articulate in giving us those effects to small businesses and how widespread these cuts are going to cause problems for our communities and for your employees. So thank you so much for being here on this roundtable. Thank you.
Oh, no. I would like to introduce our next guest, Tony Gonzalez, a health policy advocate with Families USA, and Catherine Henderson, a surgical oncology nurse at the Ohio State University Medical Center. Joyce Beatty trained me well, and a labor lead and advocate with the American Federation of Teachers. And thank you, Ms. Gonzalez, for attending with your dad. We appreciate it. And thank all three of you for participating this morning. I know it's been a long day, but your voices are so important. Tony, what was it like when you learned about your diagnosis that you had cancer, and how has it changed your experience with your healthcare system?
Yeah, thank you for the question. When I first learned about it, of course, I was shocked, but more than that, I was really worried about trying to maintain a balance between my work and my healthcare, and trying to address the cost for healthcare at the same time. So I had been an adjunct professor and was juggling multiple contracts and probably working an average of 60 to 70 hours a week. At the same time, I did not have health coverage, and so I went through the marketplace in Pennsylvania that's called Penny, and I was working to try to balance. Yep, a little closer here. Trying to balance everything at the same time. So, it's very preoccupied in how am I going to maintain a work schedule, because I love my career, I love my job, but at the same time, there's no way that I can go on disability full time. I want to provide for my family. I want to make sure they have the resources we need to maintain food and utilities and their own healthcare needs at the same time.
Thank you.
Yeah, and Tony, I'm Congresswoman Maxine Dexter from Oregon. I'm also a physician, and so that really resonates with me that a lot of our patients really are trying to balance wanting to work but needing the resources to take care of themselves. What will happen to your health care if the enhanced premium tax credits go away?
That is a great question. So I've kind of thought about that and planned ahead as well. And something that's going to impact us is if those go away, I'm faced with a few different choices. One is, of course, not paying for coverage altogether. I'm faced with paying for food, utilities, mortgage, insurances, and making sure that those are maintained. But at the same time, my wife also has chronic illnesses. And so it's just not my stage 4 cancer that is need to be treated, but also my wife has certain medical needs as well. And so now I'm faced with, okay, we need this health insurance. Do I go and get a part-time job, some kind of contract to supplement? But now I'm going against my oncologist's wishes that say, Tony, you need to slow down. You need to focus on your treatment. You can't be working 60, 70, 80 hours a week. I'm like, where's the compromise? What do I do?
Clear that it doesn't pencil out. And so again, we're making impossible decisions, and our community is making impossible decisions. So Catherine, as a physician, I know how devastating it is for patients to go without healthcare coverage. We're just talking about this. Can you tell me what worries you most about these forthcoming Republican cuts to healthcare?
Yes, thank you very much for the question. So I think that what we are facing right now is just a lot of worry and uncertainty about the future. And for patients, that is detrimental. That's life altering. No one should have to pick between, like Tony is saying, cancer treatment and paying their rent or being able to afford their next meal. So right now, the U.S. is facing a huge crisis, and we need to be working together to help American families afford health care and to be able to afford to just exist at this point, because that's really what's coming down to.
Before I hand it over to Congresswoman Kelly, I think that that is so important that we don't just continue to put people in this terrible situation where they're making these incredibly impossible choices, but that we actually make it available and affordable, because frankly, people are still going to get sick. Tony would still be sick if he didn't have health care or not, but it allows him to still work and take care of his family. It's absolutely to all of our benefit to pay for health care coverage.
You know, we've traveled we've traveled places in the United States. We were in Louisiana, and they said 33 hospitals would close if the big ugly bill was implemented. In my state of Illinois, just in the rural area, 9 hospitals. So how will hospitals like yours absorb a $1 trillion in health care costs that the Republicans just passed? And really, how will it impact your ability to provide care, beside the fact that some hospitals are going to close and there won't be close care?
That is absolutely correct. So for Ohio alone, we are looking at a potential for 11 of the rural area hospitals to close, and that will put increased burdens on those communities for them to go to other places to receive care. People don't have adequate transportation, and then to come into the cities that are already stretched. Healthcare providers are already, thin as is, and to continue on this route and put more burden on them is just astronomical detriment that will happen.
As I say, the other thing that scares me, that we're going to lose people in the healthcare profession.
Hospitals are foundational. Sometimes they're the largest employers in those communities. So if those hospitals close, it doesn't just hurt the patients, it hurts the whole community. And then pregnant women having to drive extraordinary distances to get prenatal care. Some are just going to forgo that because they need to stay close to home with their kids and their families. So we will have sicker people, worse economies in our rural areas, and frankly, it is a crisis. And I know that we've been saying crisis left and right lately, but this is a disaster that we can see, and we just keep driving towards it unless the Republicans come to the table and actually agree to fix this problem that they've created.
Definitely. I was going to ask you, how long is your hospital close to you? I know you live in Pennsylvania.
Yeah, great question. So I do have a local hospital in my area. However, I find that some of the doctors in Pittsburgh are a bit more proficient. So I travel to Pittsburgh, which is about an hour and a half away. And then I've also been working with the City of Hope Cancer Treatment Center in Atlanta for some specialized treatment there. So between Pittsburgh and Atlanta, I go back and forth for my treatment. So it's pretty arduous in and of itself.
And to me, an hour and a half sounds far. I don't know. But I just want to thank each and every one of you for joining this very special conversation. It was really meaningful, and your heartfelt stories are truly, the fuel for our fight to lower healthcare costs and ensure that every American gets the healthcare they need in the richest country in the history of the world. As people have said all through this, healthcare should be a right and accessible to everyone, not just a privilege for the well-off. So that's why we're here. That's why we're fighting. We're fighting to keep the government open while lowering the cost of health care. And we're going to keep the fight going. We're going to keep the fight going for you and you and you and, all of us. And we're going to stop this Republican health care crisis and do right by the American people, because you deserve better. So thank you for sharing your stories. I know it's been a long day, but we appreciate you all so much. And thanks to the audience for listening. Take care.
Hi, everybody. I'm Joe from Call to Activism. I'm happy to be here today amidst this crazy fight. But here I am so glad to be with Rep. Pramila Jayapal, who is the representative from Washington's 7th District. Thank you so much for joining us, Congresswoman.
I am so happy to be here and wish my Republican colleagues were here.
Yeah, so we were at the Capitol earlier and walking around, it was really a sight to behold. It's full of Democratic lawmakers, and there was not one Republican lawmaker as far as I could see anywhere. Are you experiencing that same thing?
I'm experiencing the same thing. We checked out all the Republican offices on our floor. Some of them are open, but there is no lawmaker to be seen. And here we are just hours before a shutdown, 6.5 hours before the government shuts down. And Mike Johnson has sent all the Republicans home. It is the ultimate dereliction of duty. And I'm kind of like, I want to play Where's Waldo with these Republicans, like, where are they? Why are they not doing their job and getting us ready to stop a government shutdown to make sure that we preserve the health care of the American people?
Absolutely. And Democrats are here. So for Americans who are watching, the Democratic caucus is literally here. They are ready to do whatever it takes to save healthcare, to have a budget passed that doesn't affect so many millions of people. And I think that is the best argument that this is a Republican shutdown, that the Democrats are right there ready to launch this fight, and they're here for the American people.
Yeah, and look, I think there are 3 branches of government. We've got the House, the Senate, and the White House. For any bill to be passed, you got to get through all 3. And it is true that Republicans can pass partisan spending bills through the House because they have a simple majority. And so that's what they did. They passed a partisan spending bill through the House. But in the Senate, you need 7 Democrats. And they don't have 60 Republicans. So they need 7 Democrats. And if you are governing and you're in control of the House, the Senate, and the White House, then that means that it's on you to negotiate a deal that gets you the votes that you want, not just to pass something that is partisan. And we Democrats have been saying you need to cancel the healthcare cuts that have been killing the American people from the big bad betrayal bill. And you need to make sure that we are lowering healthcare costs for the American people by extending the upcoming subsidies that are about to go out and raise premiums for people across this country. So it's really clear to us what we're fighting for. We're fighting for the American people. We're fighting for the healthcare of the American people and to make sure that people can actually thrive, not just barely survive in this horrible environment of cuts that the Republicans have created.
I'm so glad you mentioned that because, Donald Trump has this thing about himself. He calls himself the chief negotiator, and Mr. Art of the Deal. He hasn't been able to negotiate a single Democrat to go along with this horrible budget. And you see Leader Jeffries, Senator Schumer, in good faith, try to meet with him to come to an agreement, and instead he posts that awful racist AI video and completely makes a mockery of any decency when it comes to this particular debate. What's your opinion about that?
No, that's right. Look, if you're going to negotiate, you have to respect the other side. Mike Johnson disrespected our side when he sent everybody home and basically said, yeah, I'm not going to negotiate anything. Donald Trump then disrespected our side when he posted an AI. I mean, to see coming out of the White House a racist AI fake video mocking the very people whose votes he needs, to me, that's not a great negotiator. But Joe, you and I know Donald Trump says he's a lot of things. He said he was for lowering costs on day one. He said he was going to end all the wars. Remember that? He said we're at peace. He's going to be nominated for the Nobel Peace Prize because he's ended all the wars. None of those things have happened. What they have done with their big bad betrayal bill is kicked 15 million Americans off of health care, set up a crisis of half a trillion, $500 billion, $500 billion of crisis on Social Security and Medicare. And now they want to literally continue to cut healthcare for people across this country. Everyone's struggling. My constituents, they see their rural hospitals shutting down. They see their premiums going up. They can't afford healthcare already. They can't afford the cost of groceries. They're making choices to have, casseroles every night because they can't afford to have anything else. And for him to be talking about the gold in the ballroom or, whatever other crazy thing he's talking about is so unbelievably disrespectful to the American people that he's supposed to represent.
Absolutely. And, you hear the numbers, right? We know that the big ugly bill could potentially remove people, 15 million to 17 million people from their health insurance. This is the nonpartisan Congressional Budget Office said this. And here they want to go and double down on it and hurt even more people and drive up premiums. And it's so important to think that every single number, every when you hear 15 million people, each one of those is a person. It's a story. It's a child on Medicaid. It's a person that is waiting for their prescription drug medication. It's someone has Parkinson's disease and relies on this medication to prevent the disease from progressing. And for them to be so callous and for Donald Trump really to make a joke out of this negotiation, this process is really unfortunate for the American people.
No, that's how I feel. I have people, and Republicans tried to mock me and say this doesn't happen. It happens to me all the time where I'm walking through downtown Seattle, I'm walking in the airport, and somebody comes up to me and tells me about their medical crisis, right? A woman who is the wife of a veteran who's got cancer and she can't afford her cancer treatment now because of the Medicaid cuts. And because her premiums have already gone up so much, and they're going to skyrocket 15 to 20% if we don't do something upcoming. And, or even just listening to the stories this morning, Hakeem Jeffries had a presser and we were all there. And listening to, the man with stage 4 cancer whose daughter was there, and he's talking about how his wife has illnesses too. He can't afford it. He's got this huge out-of-pocket max. They can't afford healthcare in the richest country in the world. And Republicans are not trying to fix that. They're trying to take it away. And so the thing that's so important to me about this shutdown crisis, this Republican shutdown, is that we Democrats are standing up and fighting for people to have healthcare. We want to cancel the cuts. We want to lower costs for the American people. We want to save healthcare for Americans. And Republicans are actually doing everything they can to take healthcare away from people and laughing about it, treating it with disrespect, creating AI fakes out of the White House and using government offices like HUD websites to put out that this is blaming other people. So it's a terrible situation, but I'll tell you something. I am proud of Democrats for sticking together and for saying we're going to fight for the American people because we believe in working class folks and poor people across America, not the billionaires that get the trillions of dollars of tax breaks that Donald Trump is promoting for all his buddies.
Absolutely. I mean, it's perfectly said. And when you think that this is happening just for tax breaks for billionaires and what's at stake, I was really surprised to learn that 40% of Medicaid recipients are children. So this particular initiative, what they're trying to push in this budget is going to hurt kids and it's going to affect lives. And really, this is what Democrats want to do. They want to fight for kids. They want to fight for families. And Republicans are nowhere to be found on these very, very important issues.
Well, and the thing about that, Joe, that I just don't get it. And people say this to me all the time. They're like, don't they understand that their constituents are getting hurt? Right? Mike Johnson's home state of Louisiana, 60% of the births in Louisiana are funded through Medicaid. 60%. He has one of the highest populations that are dependent on Medicaid dollars. And, you look at rural areas, which are often represented by Republicans, and you look at what the Medicaid cuts will do to shutter rural hospitals. In my home state of Washington, there are 14 rural hospitals that are slated to close because of these Medicaid cuts. And so I think it's really important for people to understand that not only are they, it's not like they're just disrespecting Democrats in blue districts or blue states, right?
Yeah.
They're disrespecting their own constituents who elected them to come to Congress.
Yeah, I wanted to stay on that for a second. We even posted something very similar the other day in the sense of like, I hope the American people see that Democrats are really fighting not just for Democrats. They're not just fighting for big cities. And, you know, rural hospitals are in danger. When hospitals close, that's an extra hour. You know, if someone has a heart attack, that's an hour from the ambulance, for the ambulance to get to your house. And then it's from the house back to the hospital. And Democrats are fighting for everyone because this affects literally everyone, blue states, red states. These are people's lives, and it's a fight worth having.
The first speaker today at the press conference was so powerful, I thought. And, you know, she's a mom of 2 kids on the autism spectrum. And she was just talking about folks with disabilities and how disabilities are not things that just affect one group of people in one city or one party or one location. It happens to all of us. And this is not a partisan fight. Healthcare is not a partisan fight. And when Republicans undermine the essential nature of healthcare in our lives, right? Because it affects everything else. And if people have to make choices between food or the drugs that they need or the care that they need or housing and the care that they need, it is an impossible choice because it's threaded into everything else. And so that's why I'm so proud that we are standing up and fighting and saying no more. And, you know, I'll just say one other thing about this. It used to be, I remember when I first came to Capitol Hill, people would say, Pramila, remember that the only thing that really matters, the only thing you can count on is your word. You know, you have to make sure you keep your word. What you say, you do what you say. These Republicans just make promises and break them. It's unprecedented that we would make deals on bills around funding for different agencies, and then the other side would go pass a partisan rescissions package that strips away the funding that they just agreed to 3 months ago. And so I think that's the other thing about this that people have to know. Any deal has got to make sure that it is ironclad. I mean, really ironclad, because they just keep making promises and breaking them here in Congress, just like they do to the American people.
Absolutely. Absolutely. I'm curious, if I may, I'm curious if you had a chance to speak directly to Mike Johnson, what would you tell him if you could?
Well, you know, Mike and I came in together and we were in the same class and we actually served together on judiciary and we had a pretty good relationship. And, you know, as far as 2 people who disagree on a lot of things, he became speaker. And I would say to him, Mike, what happened to the guy that came into Congress with me? What happened to that guy? Because I remember when Mike Johnson came in, he actually pushed forward a civility pledge, if you can believe it, that we all signed. And I have raised that to him at various times because his members are not civil. That's a very nice, understated way of saying it. And I don't see that he does anything about it. But more importantly, the civility of respect to the American people to have health care and to push forward bills that are, that destroy people's lives. I would say, Mike, you came in here wanting to build something for people. I remember that guy. I might have disagreed with him on 98% of things, but I remember that guy. And that's what I would say to him. I'd say, remember why you're here. You're supposed to be here to make life better for your constituents. And what is so true is the Big Bad Betrayal Bill is so underwater in popularity because everybody understands that it is a disaster for people, whether you live in Johnson's district or my district.
Yes. Absolutely. And it really is something to say about how far away we are from that era, where we actually
Yeah.
could work together and come up with bipartisan solutions. And, maybe you didn't agree with everything, but there was deal making.
Yeah.
And it seems that is just Donald Trump has obliterated that. And just like when he came out today in that speech to generals, and he's suggesting they applause for him,
Yeah.
now you have the entire Republican caucus, ready to click their heels and literally just do whatever his bidding is, no matter how much it hurts and no matter what it costs our country.
And no matter how unconstitutional and illegal it is, people say, I think he even said this quiet part out loud. I think it was today. I saw a little video where he was talking about how, hey, a shutdown is going to be great. We can cut all kinds of, benefits for people. This is our opportunity to cut benefits. We know they want to cut Social Security and Medicare. That is what they want to cut. And they have been doing it anyway. They've already fired 150,000 federal workers just since Trump came in. And so they will use the shutdown to continue their rampage of federal agencies and programs that benefit American people, but they were going to do that anyway. So I think it's really important that people, I think that's why people are with us to say, no, stand up and fight. Don't give in, fight for us, fight for our healthcare, because we've already seen them destroying our lives. And we need to make sure that you use whatever leverage you have, however little, however much it is, use it to stand up and fight for our healthcare and for our lives.
Absolutely. I think that goes for everyone watching too. That's we're called to activism. And so that's
right.
what we push on our end. But, if you're listening and you have a Republican senator or a Republican member of Congress, please call them,
Yes.
Ask them questions, let them know your feelings that you do not want them to cut health care for Americans, because that's just not what our country does. And this is going to put people's lives at risk, and people will die basically because of these policies.
They are all, honestly, they are already, because people are experiencing the effects of these cuts, kicking families off of food assistance, making it harder for people to get access to benefits. And I'm an organizer too, so I really appreciate what you're doing. That's what I did for 20 years before coming to Congress. Now I just organize from this platform. And I would also say to people, even if you have a Democratic Congress member, for sure, thank them. But think of 10 people that you know in a Republican state, a Republican district, a Republican state. Now the thing is all with the Senate. So think about 10 people you know in a Republican state and call those people and ask them to call their senator, because we need all hands on deck. And listen, they're afraid of people power. And people power is the only thing that can defeat these kinds of, authoritarian-like leaders who are trying to exceed their power. And people power is what is stronger than that. And so this is our chance to fight back and to make sure that we preserve healthcare and that we actually make America a place that is affordable for all of us, not for the billionaire buddies that line the White House to pay homage to the king.
Absolutely. Now, the shutdown is really set to happen in a bunch of hours, but it's going to happen tonight, basically in the early morning. What's the message to Americans when they hear and they put on the news that happened?
Well, the first thing is, this is the Republican shutdown. This is the Republican disrespect for your health care. This is the Republican plan to destroy your family and your community by allowing you to lose your health care. That's 15 million people already from the big bad betrayal bill slated to lose their health care, or 17 million. It kind of depends on which estimate you look at. And more, premiums set to go up with the expiration of the Affordable Care Act subsidies. And so I think it's really important to continue those calls, and particularly into the Republicans. House members are up every 2 years. That means that the next election, these guys have to get your vote. And if they're going to oppose your health care and keeping the government open so that and restoring the cuts that they made and making sure that your healthcare costs go down, they should not be reelected. And you need to let them know that. So if you're in a Republican district, if you've got friends in a Republican district, if you're in a Republican state, if you've got friends in a Republican state, those calls need to continue because we need to make sure that they come back to the table and actually protect the healthcare of Americans.
Senators voting in the affirmative: Blunt Rochester, Fetterman, Gillibrand, Hassan, Lujan, Markey, Murray, Schatz, Schumer. Senators voting in the negative: Capito, Curtis, Fisher, Graham, Johnson, Kennedy, Lee, Marshall, Hall, Scott of South Carolina, Thune. Mr. Kelly, aye.
Mr. Rounds, no. Mr. Tillis, no. Mr. Marino, no. Mr. Warner, aye. Ms. Cortez Masto, aye. Ms. Lummis, no. Mr. Grassley, no. Mr. Kane, aye. Mrs. Blackburn, no. Mr. Cassidy. Mr. Cassidy, no. Mr. Merkley. Mr. Merkley, aye. Mr. Cornyn. Mr. Cornyn, no. Mrs. Shaheen. Mrs. Shaheen, aye. Ms. Duckworth. Ms. Duckworth, aye. Mr. Ossoff. Mr. Ossoff, aye. Mr. Durbin. Mr. Durbin, aye. Mr. Banks. Mr. Banks, no. Mr. Kim. Mr. Kim, aye. Ms. Murkowski. Ms. Murkowski, no. Mr. Sanders. Mr. Sanders, aye.
Mr. Reed, aye. Mr. King, aye. Ms. Klobuchar, aye. Mr. Husted, no. Mr. Schmidt, no. Ms. Ernst, no. Mr. Langford, no. Mrs. Hyde-Smith, no. Mr. Wyden, aye. Mr. Bennett, aye. Mr. Kramer, no. Mr. Tuberville, no. Mr. Crapo, no. Mr. Young, no. Mr. Justice, no. Mr. Wicker, no. Mr. Blumenthal, aye. Mr. Hickenlooper, Mr. Hickenlooper, aye. Mr. Scott of Florida, no. Mr. Whitehouse, aye. Ms. Baldwin, aye. Mr. Murphy, aye. Mr. Moran, no. Mrs. Moody, no. Ms. Hirono, aye. Mr. Heinrich, aye. Mr. Bozeman, no. Mr. Barrasso, no. Ms. Collins, no. Ms. Smith, aye. Mr. Van Hollen, aye. Mr. Cotton, no. Mr. Schiff, aye. Ms. Warren, aye. Mr. Deans, no. Ms. Cantwell, aye. Mr. McCormick, no. Mr. Budd, no. Mr. Mullen, no. Mr. Peters, aye. Mr. Hoven, no. Mr. Risch, no. Mr. Welch, aye. Mrs. Britt, no. Mr. Warnock, aye. Ms. Also Brooks, aye. Mr. Ricketts, no. Mr. Coons, Aye. Mr. Booker, aye. Mr. Hawley, no. Mr. McConnell. Mr. McConnell, no. Ms. Rosen, aye. Mr. Gallego, aye. Ms. Slotkin, aye. Mr. Sheehy, no. Mr. Haggerty, no. Mr. Sullivan, no. Mr. Cruz, no. Mr. Padilla. Mr. Padilla, aye.
Hello. Vote. On this vote, the ayes are 47, the nays are 53. The 60-vote threshold having not been achieved, The bill upon reconsideration is not passed.
Mr. President.
The Senate will please be in order.
Mr. President, we have order, please.
Please take your conversations outside the chamber.
In a few minutes, the Senate is going to vote on the Republican partisan status quo bill. It's a partisan status quo bill. The Republican CR was the wrong option for America a week ago. It remains the wrong option today because it does nothing, absolutely nothing, to solve the biggest health care crisis in America. As we speak, tens of millions of Americans are getting letters in the mail informing them that their health care premiums are about to shoot up by an average of 114%. For a working class family that needs health care, this is a huge increase. It's going to dramatically hurt them. And our Republican colleagues want to do nothing about it. 4 million people are about to lose coverage. 24 million people will see their health care costs go up. And even if you don't have ACA, the insurers are going to raise rates on you because they're getting so much less money because of all the cuts my colleagues made. This is a crisis. Now, I know the leader is going to show a poll that says that Democrats will be blamed for the shutdown. There are many more polls that show Republicans are blamed. The question in that poll is biased. Biased. In the New York Times, but it's biased. If you turn the... That's true. I don't always believe the New York Times. You can be sure of that. Neither do you. Okay. But in any case, here's a poll from Morning Consult today. 75% of Americans support extending the tax premium credit. 63% of Republicans support it. And 45% of voters say they'll blame Republicans in Congress for a government shutdown. Only 32% blame Democrats. It's natural that people understand that Donald Trump and the Republicans want to shut down and Democrats do not. We need to deal with this health care crisis now, not later. But the Republican bill fails to do that. I urge my Republican colleagues instead to join with us, work in good faith to keep the government open, keep costs down. This is a totally partisan bill. Not once were we approached about what our input should be. When I was Majority Leader, 13 different times we passed CRs. Why? Because every single one of those 13 times we negotiated with Republicans to keep the government open. We still want to have those negotiations today. Democrats remain ready to get to work to negotiate a bipartisan agreement, a truly bipartisan agreement to keep the government open. But we need to fix our health care system now. We need to stop premiums from going up dramatically. We need to be on the side of the American people because they are on our side in terms of getting this health care crisis fixed, one created by the so-called big, beautiful bill, which they now want to change the name because they know it's so unpopular. In fact, Republican leaders are saying, don't talk about health care because they know that we are on their side and the Republicans are not. The issue can't wait. It must be dealt with now, not in November, when it'll be too late. The Republican CR is silent on health care and the wrong option for the country. It's as simple as that. Yield the floor.
Majority Leader.
Mr. President, we're down to the wire here. In just a moment, the Senate will vote on whether or not to keep the government open. Right here, 24 pages. Not partisan, not complicated, simple, straightforward, clean, nonpartisan, short term, till November the 21st so we can finish the appropriations process. Something I might add that never happened when the Democrats were in the majority. Last year, we never considered an appropriations bill on the floor, even though 11 of them were reported out of the Appropriations Committee. Not a single one on the floor. We want to fund the government to give our appropriators, Democrat and Republican, a chance to work on bills that have been coming out of the Appropriations Committee with big bipartisan margins. Pretty novel concept, right? Well, in just a moment, we're going to vote on whether to keep the government open. And all indications are the Democrats are going to reject the clean, nonpartisan funding extension here before us and choose to shut the government down. Now, Mr. President, my friend, the Democrat leader, and a number of other Democrats have spoken at length on many occasions about the pain that government shutdowns cause Americans. And since he mentioned it, I will show this poll. My handy. This is a poll right here, the New York Times. Oh, by the way, this morning the Democrat leader used one of my other charts. Thank you for doing that. It makes my point. I'm guessing he may be, you want to use this one? Maybe not. But this one is New York Times. And basically the question on views on whether Democrats should or should not shut down the government if their demands are not met. 65% should not, 27% should. Now, granted, I mean, I don't think the issue here is who gets the blame, who gets the political blame. That's not what this should be about. This issue, honestly, folks, is about the American people. A lot of Democrats, a lot of Republicans, a lot of independents want us to keep the government open. So why are the Democrats doing this? As was mentioned 13 times when they had the majority, we did short-term continuing resolutions. Republicans delivered, voted with Democrats to fund the government. Well, I know why we're doing this, Mr. President. The Democrats' far-left base said jump, and Democrat leaders said how high. But the far-left's determination to oppose anything President Trump has ever said or done is not a good reason for subjecting the American people to the pain of a government shutdown. So I would say to my Democrat colleagues who still care more about their constituents than the dictates of far-left interest groups, think about what you're doing. Democrat leaders may be determined to take government funding hostage for their own partisan purposes. You don't have to join them. We can pass a clean, nonpartisan bill and get back to the business of the American people. Mr. President, I move to proceed to the motion to reconsider the vote on passage of H.R. 5371.
The question is on the motion. All in favor, say aye.
Aye.
All opposed, say nay. The ayes appear to have it. The ayes do have it. The motion is agreed to.
Mr. President, I move to reconsider the vote on passage of H.R. 5371.
The question's on the motion. All in favor, say aye. All opposed, nay. The ayes appear to have it. The ayes do have it. The motion is agreed to. The question occurs on passage of the bill upon reconsideration.
Mr. President, I ask for the ayes and nays.
Is there a sufficient second? There appears to be. There is. The clerk will call the roll.
Ms. Alsobrooks. Ms. Baldwin. Mr. Banks. Thank you. Thank you. Warren, Workley. Smith. Gotcha. Thank you. I got you. Thank you.
I'm deferring to my junior self. Not as little. The cellmate.
Thanks.
Thank you.
Well,
I said you, but not the cellmate. I did. Thank you. Peters. Thank you. Young. Kramer. Thank you. Thank you. Mr. Barrasso.
Coach is right here. Bozeman's next.
Good job.
Mr. Bennett, Mrs. Blackburn, Mr. Blumenthal, Ms. Blunt Rochester, Mr. Booker, Sullivan. Good job. Mr. Bozeman, Mrs. Britt. Thank you. Mr. Budd, Ms. Cantwell. Mrs. Capito, Mr. Cassidy, Ms. Collins, Mr. Coons. I got you, thank you. Mr. Cornyn, Ms. Cortez Masta, Mr. Cotton, Mr. Kramer, Mr. Crapo, Mr. Cruz, Mr. Curtis, Mr. Daines, Ms. Duckworth, Mr. Durbin, Ms. Ernst, Mr. Fetterman. Thank you. Thank you. Mrs. Fisher. Mr. Gallego. Mrs. Gillibrand. Mr. Graham. Mr. Grassley. Mr. Haggerty, Ms. Hassan, Mr. Hawley, Mr. Heinrich, Mr. Hickenlooper, Ms. Hirono, Mr. Hoven, Mr. Husted, Mrs. Hyde-Smith, Mr. Johnson, Mr. Justice, Mr. Kane, Mr. Kelly, Mr. Kennedy, Mr. Kim, Mr. King, Ms. Klobuchar, Mr. Langford, Mr. Lee. Thank you. Mr. Lujan, Ms. Lemus, Mr. Markey, Mr. Marshall, Mr. McConnell, Mr. McCormick, Mr. Merkley, Mrs. Moody, Mr. Moran, Mr. Marino, Mr. Mullen, Ms. Murkowski, Mr. Murphy, Mrs. Murray, Mr. Ossoff, Mr. Padilla, Mr. Paul, Mr. Peters, Mr. Reed, Mr. Ricketts, Mr. Risch, Ms. Rosen, Mr. Rounds, Mr. Sanders, Mr. Schatz, Mr. Schiff, Mr. Schmidt, Mr. Schumer, Mr. Scott of Florida, Mr. Scott of South Carolina, Mrs. Shaheen, Mr. Sheehy, Ms. Slotkin, Ms. Smith, Mr. Sullivan, Mr. Thune, Mr. Tillis, Mr. Tuberville, Mr. Van Hollen, Mr. Warner, Mr. Warnock, Ms. Warren, Mr. Welch, Mr. Whitehouse, Mr. Wicker, Mr. Wyden, Mr. Young. Senators voting in the affirmative: Barrasso, Blackburn, Bozeman, Britt, Budd, Capito, Cassidy, Collins, Cornyn, Cortez Masto, Cotton, Kramer, Crapo, Cruz, Curtis, Daines, Ernst, Fisher, Graham, Grassley, Haggerty, Hawley, Husted, Heidsmith, Johnson, Justice, Kennedy, King, Lummis, McConnell, McCormick, Moody, Moran, Marino, Mullen, Ricketts, Risch, Schmidt, Scott of Florida, Sheehy, Sullivan, Tillis, Tuberville, Wicker, and Young. Mr. Langford, aye. Senators voting in the negative. Also Brooks, Baldwin, Bennett, Blumenthal, Blunt Rochester, Booker, Duckworth, Durbin, Hickenlooper, Hirono, Kane, Kim, Klobuchar, Lujan, Merkley, Murray, Padilla, Peters, Reed, Rosen, Sanders, Schatz, Schiff, Schumer, Slotkin, Smith, Van Hollen, Warner, Warnock, Warren, Welch, Whitehouse, and Wyden. Ms. Cantwell, no. Mr. Fetterman, aye. Mr. Kelly. Mr. Kelly, no. Ms. Murkowski, aye. Mr. Ossoff, no. Mr. Banks, aye. Mr. Heinrich, no. Mr. Thune, aye. Mr. Hoven, aye. Mr. Gallego. Mr. Gallego, no. Mrs. Gillibrand, no. Mr. Murphy, no. Mr. Coons, no. Ms. Hassan, no. Mr. Markey, no. Mr. Lee, aye. Mrs. Shaheen, no. Mr. Marshall, aye. Mr. Scott of South Carolina, aye. Mr. Rounds, aye. Mr. Paul, no.
On this vote, the yeas are 55 and the nays are 45. The 60-vote threshold having not been achieved, the bill upon reconsideration is not passed.
President.
Senator from Kansas.
Mr. President, thank you. We just, for a second time, failed to pass a continuing resolution to allow the federal government to continue to operate. It's because we are coming to the end of the fiscal year. The appropriation bills have not all been approved, although almost all of them have been approved and approved by the Senate Committee on Appropriations, and several of them have been passed here in the United States Senate. This makes no sense to me. This is not a shutdown that makes any sense at all, and the American people, Kansans, deserve something different from the United States Senate. Every city council or commission, every school board, every local government office in my state passes a budget and then lives within that budget every year. Every local unit of government at home can figure this out, and the United States Senate is failing one more time. A shutdown means uncertainty. Shutdown means dysfunction. And the issue to me is this continuing resolution that would fund the federal government for 21 more days. I'm going to say that differently, till November the 21st. A short period of time is designed to avoid that dysfunction, to avoid that uncertainty. All that's required is that we pass a continuing resolution, 60 votes in the United States Senate, to keep government functioning so, and this is the reason it makes no sense to me, so that we can pass the remaining appropriation bills, all but one of which has been passed by the Senate Appropriations Committee, and most in hugely bipartisan ways. And for whatever purpose and for whatever reason I don't understand, that seems beyond our capability. I understand there are those who wish to bring other issues to this bill. Could we do one thing at a time, and when that one thing is as important as the continuing resolution, to do it right now, to do it yesterday, to do it tomorrow? We can't pass a continuing resolution because there are those who want to bring other issues into the bill. Could those other issues not be considered at a later time? Seems to me that passing appropriation bills, the federal government functioning, is one of the primary necessities and responsibilities of the United States Senate, of the Congress of the United States. This is simple and straightforward. Give us a few more weeks to process the remaining appropriation bills. Government continues to function while we do so. A continuing resolution, particularly long-term, is a crazy thing because it says we're going to fund the federal government at the same level in the same way that we did last year. And if it's multiple years of continuing resolutions, the same way we funded government the year before that. Does anyone believe that the priorities of this country are identical to last year? Does anybody believe that they're identical to 2 years ago? Aren't there things that deserve more money? Higher priority? Aren't there things that deserve no money? Aren't there things that deserve less money or maybe even the same? A long-term continuing resolution is a crazy idea, and the short-term resolution of a CR that we're dealing with right now is an unnecessary idea. It's unnecessary because we can pass the appropriation bills and avoid a long-term CR, and we just need the time to do it. So a short-term continuing resolution, do it, take up the appropriation bills, as this majority leader has promised to do, and this majority leader has demonstrated he's willing to do it. It's a pretty straightforward solution to me. Give us a little more time, a few more weeks, immediately begin the consideration of the appropriation bills that have been reported by the Senate Committee on Appropriations, and at the end of that period of time, we don't need a continuing resolution. We will have done our task. I yield the floor.
Senator from Hawaii.
Mr. President, I thank the senator from Kansas, and at the risk of getting him into political trouble, I am a huge fan of his. But I want to address the question that he asked, which I think is a legitimate one, which is, what's the hurry on the Affordable Care Act premiums? And there's a really straightforward answer, which is that people are getting letters tomorrow from their insurance carriers. Around 24 million people are going to get letters anytime from now until mid-November. And they are going to pay. Now, 24 million Americans are going to be told that because of the last tax bill that was just enacted by Trump and the Republicans, that people are going to be paying an average of 114% more per person per month. So it's not like we just went into a lab and cooked up an issue to try to hijack some unrelated moving legislative vehicle. The reason for this is that 24 million Americans are specifically on the ACA exchange, and they're absolutely going to get hosed. And because we're all in the same risk pool, it's not just people on the ACA exchange that are going to see massive increases in their health care premiums. Almost every American is about to see a spike in their health care premiums, just like they've seen electricity rates going up at double the rate of inflation, just like they've seen the price of vegetables go up by 39%, just like they've seen shortages of lumber and labor. We have an opportunity to do something because our Republican colleagues, at least some of them, understand the magnitude of this problem for their constituents. And so the normal thing to do in a functioning legislative body where the President of the United States does not believe that he is an elected monarch is to try to negotiate some accommodation. After all, these are all of our constituents. It's not like they're exclusively in urban areas or something. They're not exclusively Democrats. In fact, they're slightly more Republican than Democrat on the ACA exchange. And so if this were a normal functioning time in American-style democracy, the President of the United States would convene what they call the four corners, majority and minority leader of the Senate, Speaker and minority leader of the House, and we'd try to figure out whether there was an accommodation to be made to save our collective constituents from all this pain. And so when Democrats had the trifecta, When Democrats had the House and the Senate and the presidency, we didn't have any shutdowns. And it wasn't because there's more goodwill on the Republican side towards continuing resolutions than there is on the Democratic side towards continuing resolutions. The reason is because Chuck Schumer and Nancy Pelosi sat down with Mitch McConnell and Kevin McCarthy or whomever it was, and the president, and they figured out a deal. Even to raise the debt ceiling, Kevin McCarthy said, not for free. So this idea that the minority party, only this minority party, only in this time in United States Senate history, we are to shut up and do whatever we are told. And what's worse is they're asking the majority party to do the same thing. This president believes that he's a monarch. This president finds the legislative branch to be a nuisance. And you know what? The legislative branch is a nuisance. That's the architecture of the Constitution of the United States. We're supposed to be in a struggle with each other. We're supposed to argue and fight. And then we're supposed to come to an accommodation. But we can't come to an accommodation until there's a meeting. And so we're going to be here fighting for health care, and we're also going to be here fighting to reopen the government. If the clock strikes midnight and we're not able to avert this shutdown, then we are going to be here ready to deal. We understand we're not going to get everything we want. We understand we're in the minority. We understand we're out of power. But understand this, we're not powerless. We still represent, pessimistically, 47% of the, certainly 47% of the Senate seats, but something like half the country wants us to represent their point of view. And the point of view that we are representing, by the way, is shared by most of the constituents who are represented by Republicans too. And so there is still a pathway, but it has to be pursued. And so the onus is on the President of the United States and the Majority Leader and the Speaker to find that pathway. I yield the floor.
President.
Senator from Nevada.
Thank you, Mr. President. We're just a few hours away from the start of a government shutdown that could have been prevented by Washington Republicans just talking to us. But Donald Trump and Washington Republicans chose to once again put politics ahead of the American people. They won't come and talk to us. After slashing Medicaid and taking health care away from families who need it the most, Donald Trump and Washington Republicans are now shutting down the government, like I said, because they refuse to come to the table. They refuse to have a conversation. They refuse to work in a bipartisan way to stop a massive spike in health care costs for hard-working families, for all of you. And that's it. That's it. This is why Trump's about to shut down the entire federal government. You know, my dad often said, if you don't have your health, you don't have anything. And it's clear that Donald Trump and Washington Republicans want you to have nothing. Nothing. Because they're doing everything they can to take away health care from as many Americans as possible. And for every American, everyone out there, your health care premiums are about to double. About to double, everybody across the board. So while Republicans, those folks here in Washington, fight for billionaires, Democrats are here fighting for you, for your health care, for your ability to see a doctor, get your prescriptions without breaking the bank. In my state of Nevada, over 110,000 Nevadans get their health care coverage through the Affordable Care Act's marketplace. We know it as Nevada Health Link. Nearly 95,000 of those families are able to afford their premiums using Nevada Health Link, thanks to what we call the enhanced premium tax credits. So I want to be clear, because there's a lot of misunderstanding here. It's not a handout, it isn't welfare, it's just a tax break that helps lower the costs for for nearly 95,000 Nevadans so they can afford to buy an insurance policy, so they can go to the doctor when they're sick and have a copay, and go to the pharmacy to get their medication for a copay, so they can just afford their insurance. And we're talking about hardworking families, small business owners, workers who don't get health care through their jobs, so many of them. And these enhanced tax credits, they're about to expire. They're about to expire this year. And if Congress fails to act, health care costs across the board will double for everyone. Everyone. So when premium costs go up, many families won't be able to afford it any longer, meaning they'll lose their care. And the ones who can afford it, their deductible is going to be so high, they're never going to meet it, and they're still going to be paying out of pocket in ways they can't afford. You know, more than 38,000 people in my state alone, well, they're going to probably lose their coverage right away, all because Washington Republicans just refuse to extend this tax credit, allowing them to purchase their own insurance. Families, sadly, are going to be forced to make impossible choices. They'll be forced to delay care. They'll skip doctor's visits. They'll cut their medication in half. Cut those pills, give them half a shot of insulin to make ends meet. And these choices are real. They're real for these families, and sometimes they have tragic consequences. And since the beginning of this year, Democrats have been trying to work in good faith with Washington Republicans to extend these ACA enhanced premium tax credits and protect Americans' health care coverage. We've even introduced bills to extend the tax credits. We've tried to pass them right here on the floor, and at every turn, Washington Republicans have refused. They refused to hear your voice, refused to listen to you. My phone is ringing off the hook about people scared to death about losing their health insurance. And earlier today, when given an opportunity to keep the government open and extend the credits, every Republican voted no. Instead of working with Democrats to keep health care affordable, Washington Republicans are holding the government and the American people's health hostage to score political points. So I'm going to be clear here. We will not be bullied by Donald Trump, and we will not be bullied by Washington Republicans into sacrificing your health care, the health care of American families, of our children, of our seniors, of our friends and neighbors. Not now, not ever. Trump can't bully us into taking away your health care. Nevadans sent me here to fight for them, not to cave and let Washington Republicans and Donald Trump take away your ability to go to the doctor and get your medication. Everyone should have access to affordable, quality care. Health care is not a bargaining chip. It's not a political weapon. It's a lifeline. And Washington Republicans have the power. They have the power to prevent this shutdown today. Just come and talk with us. So I urge them to do their jobs. Come to the table, have a discussion, have a negotiation, extend the ACA premium tax credits, put people over politics. The time is now. Thank you. I yield the floor.
Mr. President.
Senator from Connecticut.
Thank you, Mr. President. My thoughts tonight are with the millions of Americans who will bear the brunt of this shutdown. The families in the path of hurricanes who will go without the services of FEMA, the veterans who will lack many of the helping hands in the VA, the recipients of Social Security who will be unable to verify their cards or perhaps receive payments that they've been denied, and others, millions of others Americans who unnecessarily will be hurt, perhaps people who depend on the social safety net that we have established and may be torn by this shutdown. And I'm thinking about the millions of Americans, about 24 million in total, 139,000 in Connecticut alone, who will be notified that they can buy health insurance as a result of open enrollment. But what they lack in information is whether or not that health insurance will be affordable, because they have no way of knowing whether it will extend beyond the end of the year, those subsidies that are so essential to their affording health care. And our Republican colleagues, we just heard the senator from Kansas say, there's no hurry. Well, Americans can't get sick on Donald Trump's timetable. When people are told there's no hurry if you get sick for medical care, that sounds cruel because it is cruel and it's stupid. People who go without health insurance may lack the health care that can save costs of preventing more serious illness. And those costs eventually are borne by all of us. So this misguided denial of the certainty people need that health care insurance subsidies will be extended beyond the end of the year really affects all of us. Premiums are rising already for all of us by 18% this year alone, because the healthiest people are deciding they're not going to buy health insurance, and insurance companies are predicting they'll have to increase their costs to cover the sicker people who will buy the health insurance because they need it. But the simple fact is, nobody is invincible. All of us need health care. And the Affordable Care Act recognizes that health care in America aspirationally should be a human right. And our failure to provide it to those millions of Americans who will find health care insurance unaffordable is unacceptable. And that's why we are taking this stand, and why America can't wait for Donald Trump to tell them that they are sick enough now to be given this subsidy, which they deserve. I'm here to urge my Republican colleagues to stop rolling over for Donald Trump. Their constituents, as well as ours, are affected by this delay in providing affordable health insurance. For months, we have been calling attention to the need to act now. And this shutdown was avoidable. The path to stopping it was available, and shortening it, assuming it will occur, is still a possibility. If we come together, if Republicans are willing to negotiate, if they come back to town, House Republicans are out of town. They are out of touch with reality. And the way forward is simply bipartisan negotiations, coming together, reaching a solution, as is the way shutdowns have been avoided in the past. The fact is that Donald Trump's so-called big, beautiful bill, actually a big, blatant betrayal, along with inaction and avoidance by Republicans, are already wreaking havoc on Americans. In Connecticut, health insurance rates for 2026 have increased by nearly 18%, the largest increase in the last 6 years. Without the subsidies, consumers with ACA coverage will see premium increases in the range of 75%. I have visited with hospitals, community health centers, physicians, and many more who have raised their deep concerns about the impending cuts in Medicaid. The budget bill Republicans passed in July is threatening also Medicaid coverage for 158,000 Connecticut residents. And anyone lucky enough to keep their coverage will see reduced benefits as the state struggles to make up the differences in lost federal revenue. Americans and our healthcare system simply can't afford to be nickel and dime like Republicans are forcing them to do. The ACA premium tax credits have protected millions of Americans from higher healthcare costs. They've reduced the number without healthcare insurance. They've provided robust choices for consumers and provided stability for healthcare providers, particularly in rural areas, and there are rural areas affected in Connecticut. And in addition to the impending cuts in Medicaid, Republicans are refusing to extend these subsidies. It is cruel, it is unnecessary, it is dumb. So I'm here to advocate for the 139,000 Connecticut residents who depend on these credits and the 24 million Americans who are making decisions about health care insurance coverage right now at their kitchen tables, in their living rooms, in their homes. It should not be a partisan issue. At the end of the day, it's a choice. Do we choose a highly successful solution that has reduced health care costs for the whole nation, or do we allow the clock to run out and raise health care costs for families in every state in this country? That choice can still be made in the next 24 hours, in the next 2 days, to shorten and lessen the pain that will be felt by Americans. I choose to stand with working families. I will fight, and we are unified in our fight as a matter of conscience and conviction. We will not be bullied. Donald Trump should know that we will stand strong for working families in America. They deserve health care. It is about saving health care and holding Donald Trump accountable to follow the law. When there is a budget, when it's passed by Congress and signed by the president, he cannot be allowed to simply ride roughshod over it and disregard it. It is the rule of law and health care that's at stake here, and I will fight for them. Thank you, Mr. President. I yield.
The senator from Rhode Island.
Well, we are headed into a miserable situation. It is a miserable situation for all of the federal employees around the globe who are going to be put into shutdown mode. It is a miserable situation for our country as the rest of the world looks at us as the gang that can't get its act together and pass simple funding bills for the government. It is an extraordinarily frustrating moment to be here now. There are very few people for whom this is not a miserable prospect, but there are a few of them. And one of them is OMB Director Russell Vought, who is a strange character who has spent his life in the care and feeding of the fossil fuel industry and big polluters, and who takes a perverse joy in destroying American government from the inside. Mr. President, I see that the Majority Leader has come to the floor, asked unanimous consent that when he is concluded and I pick my remarks back up, my remarks be linked back together as if they had been made without interruption.
Without objection.
With that, I yield the floor to the Leader.
Thank Mr. President. Thank the Senator from Rhode Island for yielding. I'll be very quick here. Mr. President, I ask unanimous consent that the Senate be in a period of morning business with senators permitted to speak therein for up to 10 minutes each.
Without objection.
I ask unanimous consent that the Senate now proceed to the in-block consideration of the following resolutions which are at the desk. SRES 427, SRES 428, SRES 429.
Is there an objection to proceeding en bloc? Without objection, the Senate will proceed en bloc.
Mr. President, I ask unanimous consent that the resolutions be agreed to, the preambles be agreed to, and the motions to reconsider be considered and made laid upon the table, all in bloc.
Without objection.
Mr. President, I ask unanimous consent that the Committee on Judiciary be discharged from further consideration. The Senate now proceed to SRES 396.
The clerk will report.
Senate Resolution 396, condemning the tragic act of violence on September 10, 2025 in Evergreen, Colorado, and so forth.
Is there objection to proceeding to the measure? Without objection, the committee is discharged and the Senate will proceed.
Mr. President, I ask unanimous consent that the resolution be agreed to, the preamble be agreed to, and the motions to reconsider be considered, made, and laid upon the table.
Without objection.
I ask unanimous consent that when the Senate completes its business today, it stand adjourned until 10 a.m. on Wednesday, October the 1st, that following the prayer and pledge, the journal proceedings be approved today at the morning hour be deemed expired, and the time for the 2 leaders be reserved for the use later in the day. Morning business be closed, and Senate resume consideration of calendar number 115, S2296.
Without objection, so ordered.
Mr. President, for the information of my colleagues, senators should expect 3 votes at 11 a.m. and further votes later in the day. If there's no further business to come before the Senate, I ask that it stand adjourned under the previous order following the remarks of my colleagues.
Without objection. The Senator from Rhode Island.
So there will be misery ahead for most normal people, not counting the weird ones who like.
I'm not going quietly into the night. While Republicans make our families poorer, sicker, hungrier, and more vulnerable, all in the name of so-called efficiency, that is not what we're here to do. To every family in the Massachusetts 7th and across our nation who would be impacted by a Republican shutdown, know this: I see you. I'm fighting for you, and I will not give up. Thank you, family. Appreciate you.
Where's Bob? Oh, I can't see anything, sorry. My name is Steve Gomez. I'm a father of 3 from Gilbert. Work in the telecommunications industry. First off, I have to state, Speaker Emerita Pelosi, that story that she told about the baby that was born with a heart condition and the $2 million in care, that was mine. So our journey's been a long one. My wife and I are self-employed, and we've been on the ACA for the past 5 years. That's how we've gotten our health care. During that time, we have seen our premiums go up. Everything goes up in price. Obviously, you know who can't help that, right? But the way that they've gone up recently and the way that they will continue to go up with the way that the Republicans, with everything that's happening with this bill that has been passed and the reduction of the subsidies and tax credits, is just, we can't even imagine what's going to happen, how bad this is going to be. I'm not trying to be boastful, but I'm proud of my house. We have lived in a beautiful 2,800 square foot house in Gilbert, Arizona. Pool, it's beautiful. We love it. I love our house. Worked hard for it. My health care premiums are $677, more than my mortgage every month. We've taken and utilized the ACA subsidies in the past, as have millions of families. And families like ours, like many others, need these programs in order to keep their children healthy and in school, to keep parents healthy, working and providing for their families, to keep the economy and their systems going. But if these subsidies expire, it's going to be catastrophic for millions. Families are going to have to choose between health care and other necessities, rent, utilities, groceries, etc. Yet the Republicans have chosen billionaires and corporations over their constituents, as evident by the fact that all of the Republican congressmen and congresswomen have flown the coop. The little boy that Ms. Pelosi mentioned, my son Anthony, he required and received a heart transplant at 6 weeks old. Since then, obviously, you have to provide care for his heart, but we've had a number of other specialties, including neurology. As a matter of fact, as I'm here, heavy-heartedly, he's in Phoenix Children's Hospital right now for seizures. He was admitted about half an hour ago. We have been told we utilize a higher premium, higher deductible plan through the ACA. We've been told by a number of people, well, go to a lower tier plan, spend less on your health care, or, don't cover Anthony because he is covered by Medicaid, another program that's taking a massive hit thanks to the big BS bill. But we don't do that. Like so many others, we are not looking for a handout. We're looking to provide and looking to do our fair share, unlike all these damn billionaires. We choose our plan based on the fact that Anthony's doctors are covered. Anthony's doctors are in network so that we can get the coverage for him and we can pay for it as much as we can. Do we offload some of that on Medicaid? Yes, as a secondary, we do that, and it's taken a lot to do that. But we are trying to, again, pay our fair share. Medicaid being under attack is another thing that we are so angrily afraid of. The cuts and the effects of these programs, and the fact that it's going to have so many impacts on children and families across the state of Arizona and across the entire country are just so frightening. We have a number of people and families in our community that also utilize Medicaid to get services, whether it is straight medical services, whether it's therapeutic services, physical therapy, speech therapy, all of that. And everybody is afraid at the letters that they have been receiving from the Mercy Care Access branch of Medicaid, the Department of Developmental Disabilities in Arizona, as to their services being taken away or being reduced. It's a real life nightmare that people in Arizona and people across the country are facing. We have to remember that for the first 4 years of him being in office, we heard about how he and all of his lackeys and cronies were going to replace the ACA with something bigger, better, and cheaper for the American family. Of course, that amounted to the same thing that most of his statements amount to, and that's just a bunch of hot air. Now, thanks to the big BS bill, he and his lackeys have passed, and the fact that they will not pass any health care extensions of the subsidies in this budgetary exercise, they're going to strip away health care from millions of families across the country. But of course, they're giving it to, they're doing it to give tax cuts to those who need it the most. Bezos, Musk, and the rest of the billionaires, right? Being frank, I don't know how to say this without sounding curt. I feel the shutdown almost might be a good thing. It is time for us as the people and the Democrats to hold the Republicans accountable. The shutdown is a result of them choosing their billionaires over the middle class and over their constituents. They always speak about wanting to speak about, well, we'll talk about it in December. It'll be a clean bill then. But kicking the can down the road is nothing but it's going to put healthcare interests in a corner again, back us into a corner, and put their interests at heart. Give them the advantage, and that's not fair. They've known about the cost of this bill. It's been publicized. It was publicized months before it passed. They've known about it, and they've known that the detriment it was going to do, the damage it was going to do to the health care for the American people, and they've chosen their side in this argument. They've chosen where their interests lie. I feel horrible for the cafeteria workers that were mentioned, for security guards, for all these people that are, park rangers that are going to be furloughed over the next few months. Hopefully not that long, few days, weeks, hopefully. But if that happens, it needs to be placed squarely on the shoulders of the Republican Party and of their dear leader. I'm not even speaking his name. It has to be placed on them. They need to own it, and the Democrats need to send the messaging to make sure that they know that this was their choosing. It was nobody was forced into anything. It was their choice. With that, I want to introduce Ms. Laura Packard, another great advocate. Thank you.
Thank you. Hi, my name is Laura Packard, and I'm a small business owner in Alexandria, Virginia. Thank you, everybody who's still out here tonight. It has been a long and hard day. But let me tell you a thing about long and hard. I'm here because the Affordable Care Act saved my life. 8 years ago, I was diagnosed with stage 4 cancer, and what that meant was 6 months of chemotherapy treatments. Every other week, I would go to the chemotherapy center, sit in a chair. They would inject 4 types of poison into my body for several hours. I would then spend a week or more feeling like hell. And just when I was starting to feel better, it was time to do it again. That was my life for 6 months. But that wasn't even the worst part. The worst part was the day after that first chemotherapy session when I was on my couch trying not to die. That's when Republicans in the U.S. House voted to take away my health care and the health care of millions of other Americans, and then they held a party to celebrate. That was 8 years ago, and now they're doing it again. But we know how to do hard things. We are here to fight for the health care that all of us need and deserve. So thank you to every speaker tonight. Thank you to everybody who is attending here tonight, because when we fight, we win.
I'm a little challenged in the height department here. And I know it's getting kind of late, and we've been here for a long time, but are you really ready to fight for health care over billionaires? Oh, come on! I can't hear you! Are you ready to fight for health care over billionaires? That's more like it. I'm Julia Tilley, and I'm a home care worker from Harrisburg, Pennsylvania. I take care of my daughter who has physical disabilities as well as autism. Home care workers have the essential job of empowering seniors and people with disabilities to live with dignity, health, well-being, and freedom in their own homes, because no one wants to live in an institution. Like many home care workers, I had to quit my full-time job to care for my daughter. And I'm very proud that I was able to make that decision, but it has been very financially difficult for my family. For my home care work, I only make $14 an hour. I have no health care benefits from my job. I have no time off, no vacations, no sick days. My daughter and her home care and all her health care are funded through Medicaid. For a long time, my husband and I also relied on Medicaid for our health care, and just last year we were able to switch to our state's private insurance program through the Affordable Care Act. So our family is facing a double whammy of cuts to both Medicaid and the Affordable Care Act. A situation that no family should have to face. These cuts would absolutely devastate our family and the health and the economic security of working people across our state and across our nation. The Medicaid cuts would rip health care from over 600,000 of the most vulnerable Pennsylvanians, including seniors, people with disabilities, children, and low-wage workers. If the ACA tax credits expire, for our state's health insurance, the marketplace premiums would skyrocket by an average of 82% for 450,000 people. It is a shame. For an example, if there was a couple, each of them making $50,000 apiece, their premiums for both of their insurances combined would be $24,000 a year. Imagine trying to fit that into your budget, right? So taken together, the Medicaid and the ACA cuts are going to put almost 900,000 Pennsylvanians in danger of losing their health care. And these cuts won't just impact people who depend on Medicaid and the ACA. Everyone will face increased health care costs and drastic cuts to health care services. This crisis is coming at the absolute worst time when America's population is aging, struggling with chronic diseases, and needs much more care than ever before. We don't need less money, we need more money. And my congressman, who I know is not here, Scott Perry, he's never where we want him when we want to talk to him. We've held town halls in Pennsylvania, invited him over and over, and he never shows up. And he's shown that cowardice today. We also have 8 other Republican congressmen in our state that also have enthusiastically supported these cuts. And why they're pushing the biggest health care cuts in American history? Just to pay for the biggest tax giveaway to billionaires and corporations in America's history. And that is a shame. They extended the tax credits for the billionaires. Right, but now they're refusing to extend the tax credits to keep people healthy. That really ticks me off. It is unacceptable and it is un-American. It doesn't matter if you're Republican, Independent, or Democrat. We are all in the same boat. Everyone should have the freedom to afford the American dream, especially health care. And if billionaires just paid their fair share in the richest country in the history of the world, we could so easily fund what we need and more. I'm here today to call on all our elected leaders not to bow down to billionaires who have taken over our public system, our political system. Don't sell out just to give your billionaire masters handouts. Do absolutely everything within your power to restore Medicaid funding, to extend the ACA tax credits, to stand tall and fight for the health of your working and middle class constituents. Thank you.
Hello, everybody. My name is Bernita Richardson. I am a physician assistant who did not plan on becoming a Medicaid advocate, but I also didn't plan on becoming a full-time caregiver for my mom, my dad, and my son. Life throws challenges at you, and we, like many families, rise to meet them. We sacrifice and we work with what we have. But let me be clear. What makes this possible is Medicaid. It's the difference between my family having what they want, and what they need, or nothing at all. But now, with Representative Kiggins and other Republicans voting to slash Medicaid funding, I'm left wondering how long we will be able to hold on. We're already living off my savings, my parents' Social Security. We're bracing for higher health care costs on top of extremely high grocery bills, rising gas prices, and even utility bills are going up. And now this. These are not just numbers on a spreadsheet. These are our lives. But let's be honest about how we got here. Republicans in Washington, led by Trump, passed a law that gave away $4.5 trillion in tax cuts to billionaires and giant corporations. That wasn't for free. It came with a cost to our families. families like mine, and being forced to pay on top of worrying about how we'll pay for prescriptions, doctor visits, medical devices, and home health care. It's not fair. Now we're facing a government shutdown that we hear is on its way just a few hours from now, higher ACA premiums, and devastating cuts to Medicaid and Medicare, all because Republicans chose billionaires over the rest of us. They had a choice. They could have let billionaires pay their fair share. Instead, they gutted programs that working people depend on and still added trillions to the national debt. We don't need or want another excuse. We need accountability. We need leaders who will stand up for working families. Because here's the truth. With a fair tax system, we could afford the care, the education, and the opportunities that every American family deserves if only billionaires paid their share. Including Trump. We don't need more tax breaks for billionaires. We need policies that help working families, people like me, my son, my parents, and people in my community. So I'm here to say loudly and clearly today that we are watching. We see what's happening. We will not be silent, and we will fight back because there's too much at stake. Thank you. I am Bernita Richardson, and I'm turning it over to my friend Paul.
Yeah, it's pretty dark, but hey everyone, I'm Paul Asadebe. I'm a federal worker. I'm a steward with AFGE Local 476 at the Department of Housing and Urban Development, and I'm an organizer with the Federal Unionists Network. And up until yesterday, I was also someone who helped everyone in this country get access to safe, affordable housing. Wow. That's housing for every single American all across this country. But yesterday, I was one of two people as a whistleblower who was fired for telling the American people about what the government was already doing to shut down their rights, their civil rights, their ability to access housing. And since the government was already shutting down, I want to tell you exactly what they were doing to shut it down, because they've attempted to retaliate against me and anyone who speaks out to defend the truth and defend the public, but I'm not going to be silent. I'm going to tell you exactly what is happening to your government and to your rights. So even before the shutdown, this billionaire shutdown that we were barreling towards, they were already shutting down our ability as federal workers to protect and serve you. They were already firing and chasing investigators who investigate civil rights out of the government. They were already interfering with decisions to bring cases, to investigate cases, to actually file complaints and protect people's rights. They're already going back in time. And when the person who allegedly discriminated and the person who was harmed by discrimination come to an agreement and say, we're going to resolve it like this without costing the public more money and more time so that people like me can work on other cases. They're going back in time and saying, we don't like that decision. We don't like the agreement that you came to. We're just going to get rid of that. We're going to stop enforcing that. Wow. That's what I mean when I say the government was already shut down. We're already having federal workers stop from being able to protect you. And as a union steward, I can say that one of the biggest things they've attempted to shut down is our union rights, our ability to organize in the workplace and stop the attempts to steal your rights. That's what we do as federal workers and as union members. So in this moment, when we're being told that the government should never shut down for any reason. That's what you say in normal times. That's what you say when it's business as usual. But right now, in the midst of an authoritarian takeover, when people's rights are being taken from them, when people who devote their lives to public service, like me and my coworkers, the other whistleblowers, when we're prevented from doing our jobs, it's not business as usual anymore. It becomes, at that point, even though none of us want a shutdown, I just want to be allowed to do my job and to serve you. But in a time when we can't do that, it becomes a time to fight instead. Even if that means a shutdown, whatever that means, whether we have to organize as working people all across the country, as federal workers, and as people in Congress, we need all of them to do their jobs and let us do ours. And when we do that, I think we're not going to be worried about whether there's a shutdown or not a shutdown. We're going to have a situation where people have a government that serves their needs and that serves every single person in this country. And until we get that, we're going to need to fight in every way we have access to. So until we get that, until our healthcare rights are restored, until our free speech rights are restored, until our housing rights, until science is respected, until working people are respected, we're going to have to fight. And that's what we're here to encourage Congress to do, and that's what we're all here to do ourselves. So it's late, but later tonight and tomorrow, and as long as it takes, we're all going to fight.
Good evening. My name is Joshua Feldmark, and I am a solar power developer. I do commercial, industrial, and community solar for a national leader in providing solar energy for state and local governments, universities, school systems, and hospitals. What I'm here today to talk about is the economics of energy and power. Let us start with the headline from the Washington Post a few weeks ago. Amid explosive demand, America is running out of power. The economics here are very simple. Demand is surging, and we are not generating more power. So supply isn't meeting demand. So economists from socialists to free market libertarians will tell you this scenario always causes one thing: prices to go up. Americans in the past year have seen devastating increases in our power bills. The actions of the Trump administration and the Republican-controlled Congress are directly to blame. Within H.R. 1 was a series of steps meant to deliberately dismantle and destroy the solar industry. With the Trump administration and Republican-controlled Congress's blunt force trauma to the solar industry, what they managed to do was devastate the entire energy sector, not just solar. You see, energy developers need stability and predictability more than anything. With H.R. 1 and the actions since its passage, the Trump administration and the Republican-controlled Congress have sowed nothing but chaos and destruction across the energy markets, which has had a chilling impact on the development of newly generated energy from any source. It takes forever to build new plants for this archaic energy sources that are preferred by the Trump administration and the Republican-controlled Congress. To get these slow sources of energy, like gas and coal, it takes 10, 15, even 20 years. In the meantime, demand goes up, supply does not, and our energy bills go up and up and up. Large-scale solar, on the other hand, can be built and generating power in as short as 3 years. And despite what this administration and the Republican-controlled Congress would have you believe, It is cheaper than gas, coal, and nuclear. One more time so we all understand. The result of the chaos and destruction from the Trump administration and the Republican-controlled Congress is that every single American resident and American business is going to continue to have skyrocketing energy bills. Sadly, that's not even where this story ends, as we know all too well. It says here, if the Trump administration and the Republican-controlled Congress see fit to cause a government shutdown, I'll change that to now that the Trump administration and the Republican-controlled Congress clearly see fit to cause a government shutdown, good projects that are now being fast-tracked to meet the Trump administration's arbitrary and capricious deadlines will all face unbearable burdens and as a direct result of this shutdown. If the Trump administration, now that the Trump administration and the Republican-controlled Congress are closing the government and allowing more pain and suffering, more loss of income,
including many in New Jersey, that is a catastrophe that we see coming. We knew it was coming, and we were trying to take action to be able to address that. And what happened? Kicking the can down the road. When does open enrollment start when it comes to healthcare? Starts in November. So what good is it if we punt towards Thanksgiving, which is what this body tried to do? They need solutions now. They need answers now. And they're not getting it, and they're certainly not seeing anything that resembles leadership in this country right now. So yes, when I'm hearing from Lorena from Forked River, who says that, literally could lose her current health insurance if the ACA premiums go away, that's what we're fighting for. That's what I hope people see over the coming period as this continues on. Because I know it's so easy to make it feel like, again, it's just completely detached. And often it really seems that way. It feels like people here in the Senate, here in Congress, at the White House, that we're playing with other people's chips, that we don't feel it ourselves. I have to say, I found it disgusting when I learned in 2019 and I came into Congress that the president and members of Congress get paid during the shutdown, that they continue to get their salary while service members in our military and other public servants do not, even though they are showing up to do work. We should not be held to a different standard. We should not be in a place where it seems like we're above the rest. Because that's exactly what the rest of the American people believe. They believe that we think that we're above the law, that we don't have to obey it, that we don't have to follow the rules that other people do, and that's why they are losing trust in this government. And I can tell you, come midnight today, they have every bit reason to believe that, because we have failed to ability to be able to deliver for so many people. We had Lucinda from Whiting write in telling us, begging us to hold the line when it comes to fighting for health care. Because in her words, quote, I definitely cannot afford my ACA insurance without the advanced premium tax credits. If costs go up and health care gets more expensive, I will have to go without insurance and not go to the doctor. These are just a fraction of the thousands of calls and emails and outreach that we've received. We asked people to share their stories. We got over 3,500 stories back just this week about people's concerns about what's happening with this shutdown and losing health care. We need to recognize that a president who can't even be bothered to learn about the hurt that is being put forward by his own party when it comes to our health care, that our bill is not one that is looking out for them. We need leaders who understand what is going on. We need leaders who care about the people they are supposed to be leading. We need leaders who will actually be the adults in the room. And yes, so I rise today to make that promise to New Jersey and to the American people that I will keep fighting for you and fight with you as we go through this. And we're going through uncertain times. We're entering unprecedented times. And I know that it's a lot for everyone. But again, we remember why we fight here. That while I'm giving this speech, I'm worried about the care that my father's getting, and my father's health is declining rapidly. Every single one of us knows what it's like to have a loved one struggling when it comes to their care. And I know everyone knows that experience of saying that we would try to move heaven and earth to be able to make sure that they get the care that they need in their time of greatest need. And how can I, when I stand by thinking about 4.5 million Americans, including many in my state, losing health care, making it harder for them to be able to deliver for their family, how can I say that this is a time to roll over, that this is a time to stand down? No. We draw the line here. We fight for your health care. We fight for your lives, your ability to deliver for your loved ones, and to be able to stand up together and say, this is not how our government should work. This is not how our democracy should function. We deserve better. The American people deserve better, and that's what we're going to fight for. We're going to fight for better. With that, I yield back the floor.
The Senate stands adjourned until 10 a.m. tomorrow.
Major surgeries in his life. We stopped counting at 50. And he is remarkable. He was just recently diagnosed with the superpower of autism, so we've added that to his bio at this point. But I just think it's very important to recognize that the two work together. And I have private insurance, and I hear that from people all the time. Are you not willing to pay for insurance? I have private insurance. I've been a teacher for over 20 years. I'm doing it. I'm doing what I need to do. And I need my government to do what they're supposed to do. And I think that one thing the Republicans haven't realized is they messed with the wrong group. We are caregivers. This is what we do. I have fought Isaac's entire life. I started fighting before he was born when I was told that I should consider terminating his pregnancy. And I did not. I had a choice. I made a choice. And he is here. And now the people that really want you to have those babies don't want to take care of that baby. And it is infuriating. And I have taken on doctors, I have taken on insurance companies, school systems, nursing agencies, therapies. The Republicans are nothing. I'm ready. So you picked a fight with the wrong group, and we are ready to fight back. We will not stop. I don't know how to stop. I have been doing this Isaac's entire life, and I don't know how to stop. Just like Geneva and Rob, we've been here doing this together since 2016. So in closing, we are just asking that our Democratic leaders fight for our families and continue to defend our disabled children from this regime that is hell-bent on taking away their health care.
Okay. Oh, Rob, yes. Rob is next. This is my son, Rob. And he can speak for himself. I just have to turn this device up. Okay, come on. There we go. All right. Okay, Mr. Rob. And Rob activates this with his eyes, if he would be so kind. Rob?
Hi, Bob.
Hi, Rob. Let me hit it for you. Yeah?
My name is Rob Stone. I use he, him pronouns. I'm here today to represent little lobbyists. I'm an artist and advocate for healthcare and disability rights. I live in Maryland with my family. I am 28 years old, and I am fighting for me and other disabled children and adults to live with dignity in our communities. Medicaid home and community-based services are my lifeline, but congressional Republicans have slashed Medicaid funding. I want to live a fulfilling, independent life in my community. I should be able to control my own life, just like anyone else. I'm a grown-ass man and should not have to rely on charity or have to live in a facility. Republicans said they wouldn't hurt the most vulnerable people on Medicaid. Well, they lied to everyone. Republicans own this government shutdown. Republicans have to fix this by putting back all the Medicaid funding they stole from me and other vulnerable people.
All right, you're awesome.
Fight back, Rob! Fight back, Rob!
That's right. Okay. So, following up on what Rob said, I'm Geneva Stone, also representing Little Lobbyists, a family-led group advocating for kids with complex medical needs and disabilities. And this summer, Rob and I, along with Kim, rolled through the halls of Congress as Republicans were preparing to vote on their big, ugly bill. Over and over again, congressional Republicans told us that they only wanted to cut waste, fraud, and abuse, that they wanted to protect the most vulnerable among us. They did. Over and over again, we explained to them that Medicaid's home and community-based services are optional services for states, that states would, when faced with draconian cuts to Medicaid, reach for the low-hanging fruit, optional services. Republicans didn't listen. For 28 years, I've been Rob's primary caregiver. Rob was born an apparently typical baby, at the age of 1, as if the brakes had been hit hard on a speeding car, going from 60 to 0 in 24 hours. He's back up to 60 now, though. Rob's whole body broke down, and he was in the hospital. Our entire family was thrown into a skid. That, of course, when it happens, is like people think that couldn't happen to me, but it did.